We're going to be palpating the muscle gluteus maximus. So gluteus maximus is this muscle in this area here. Before I go into palpation, I'm just going to make sure that my body here is okay with palpation in the area. Are you okay with that?
Mm-hmm.
Okay, so we're going to be starting with the origins of gluteus maximus. And the first thing I'm going to be looking for is the iliac crest. So right in here is the top of the iliac crest, and I'm working my way down along this posterior iliac crest. Here is the pes. So gluteus maximus is originating on that posterior iliac crest, and then it starts to run down along the lateral border of the sacrum. So below the pes, running inferior, slightly medial. And then when we get towards the inferior corner of the sacrum, I'm going to change over onto the median sacral crest, and I'm going to be walking down towards the coccyx. So this is the bottom of the sacrum here on either side of the cornu, and then inside is the hiatus, and then just inferior to that is the coccyx. So gluteus maximus has an attachment to this coccyx via the sacrotuberous ligament, which I'm going to be palpating next. The sacrotuberous ligament is coming off the lateral and inferior part of the sacrum, and it secondarily attaches to the ischial tuberosity right in here, kind of the bottom or upper part of his thigh where the hamstrings attach. So our ligament is going to be running on a diagonal. So if you move off the corner of the sacrum and you start working your way down towards ischial tuberosity, you will find a fairly obvious ropey band. This is the sacrotuberous ligament. I'm going to be using two hands just to try and show you the entire attachments of it. So all along the whole sacrum, iliac crest, and down to the sacrotuberous ligament. As you can see, this muscle is quite large. So it actually gets split oftentimes into an upper and a lower section, which are going to have different actions. We're going to be firing this muscle off. So I'm actually just going to reach down and grab my partner's leg here. And I'm going to ask for them to lift it up towards the ceiling and just hold it up in the air and then bring it back down. So this is extension at the acetabulo-femoral joint. Plus I'm going to add in just a little bit of a lateral rotation and have them do it again and hold their leg up in the air. Okay, so you can easily outline the muscle as you're having them perform this action and follow it towards its insertion point. We're going to bring the leg back down. So the upper portions of gluteus maximus are responsible also for helping with abduction, and the lower portion of it is also going to be an adductor, adduction. And as I said before, the whole muscle is going to be doing extension. So I'm going to be following it towards its insertion point. I'm going to first start to landmark and look for what is known as the greater trochanter of the femur, which I found here. I'm going on to the posterior aspect of this greater trochanter, and then I'm going to move inferior and slightly medial onto the gluteal tuberosity. So I believe I'm on the gluteal tuberosity right now. I'm going to again ask him to just start to lift his leg up. Perfect. And back down. And this is right where gluteus maximus is going into bone. That gluteal tuberosity is a kind of a continuation of the linea aspera of the posterior femur. And then the secondary attachment that it has is along the outside in a soft tissue attachment, which is known as the iliotibial band. So over top of vastus lateralis. Again, if he was to lift up his leg and hold it in the air, you can definitely feel a tightening of the iliotibial band. And you can even see it right down in this area right in here where I'm pushing. You can see the iliotibial band is tight, and that's why you're getting that effect as I'm pushing on it. Okay, and he can lower his leg. All right, that is concluding our palpation of gluteus maximus. We're going to be palpating gluteus medius. So I'm going to orient ourselves with the origin, which is on the ilium. The first thing we're going to be doing is finding the iliac crest and going posteriorly until I find the pes, the posterior superior iliac spine. So just anterior to the pes lies the beginning of what is known as the posterior gluteal line. So that's going to travel up just anterior to the pes and then start blending into the iliac crest, kind of like I'm trying to show with my hand. So gluteus medius originates in between this posterior gluteal line and the next line known as the anterior gluteal line. So there's our posterior gluteal line. Now for the anterior gluteal line, I'm going to label a couple other bony landmarks. First thing I want to do is find the greater sciatic notch. So if I find the PSIS here, I go inferior, I have the PIS, and then I end up dropping into this sciatic notch right here. So this is the greater sciatic notch. And I'm going to travel a little bit anterior into the notch. So again, PSIS, dropping below, PIS, and then sciatic notch. And we're going to trace a line that runs forward and up, heading in the direction of a bony landmark known as the iliac tubercle or iliac tuberculum, depending on your source reference. So this right here, greater sciatic notch, and this landmark here, iliac tuberculum. Another way to find that tuberculum, in case you need it, is to start at our ASIS here in the front. You go to the lateral aspect and start traveling posteriorly along the iliac crest, and it should stick up a little bit. So this imaginary kind of line, because I won't be able to feel it directly, is my anterior gluteal line. So gluteus medius originates in between the posterior and anterior gluteal line on that external surface of the ilium. So we have a nice wide O, and then these muscles are going to start coming towards a point, kind of a triangular shape, and they start inserting on the femur. One of the things I like to mention, might be easy to help you, is called pie in the sky. So we have a triangular slice of pie here with a wide kind of beginning, and then it narrows towards a point. And in the sky part is for the palpation of medius and its manual muscle test. I usually have it facing up towards the sky. So we're putting them in a sideline position. As the muscle goes towards its insertion, again, as I said, we're going to look for the femur, specifically the greater trochanter. Now I'm going to grasp her ankle, and I'm going to lift it up and do a little bit of an internal and external rotation, and I can easily feel the greater trochanter moving underneath the surface. So I'm helping to identify them in the right spot here. And gluteus medius originates on this outer, or otherwise known as external surface of this greater trochanter, the femur. So right in here is our insertion. So we have our origin, and then tapering down towards our insertion. A lot of people will reference gluteus medius as the deltoid of the hip, and I think that reference primarily comes because it does all the similar or same actions as the deltoid. But in this case, it is going to be a little bit more posterior, which means it's going to be better at doing a couple actions. One of the main functions, just like deltoid, is it's going to be doing abduction. So I'm actually going to ask my partner here just to hold her leg up so she's lifting her knees apart, and I'm going to add a little bit of resistance down on her knee, and that's really going to tighten up the gluteus medius as they're trying to do abduction. To separate it from minimus, which we'll get into a little bit, is minimus is more straight up and down in its fibers, so that is more of a pure abduction. But because a lot of glute medius is towards the back, you actually tend to have a little bit more of a extension and external rotation as you're doing abduction, like so. So I'm going to go right into the middle of that muscle belly area, and then I'm going to have this person lift their knee up towards the ceiling. Good. And you can quite easily feel gluteus medius activating as we're going from the origins towards the insertion. All right, that is going to conclude my palpation of gluteus medius today. We're going to be palpating gluteus minimus. So I'm just going to orient ourselves with our origins on that ilium. So again, similar to gluteus medius, if you've already previously watched that video, this is going to be originating on the outside or the external surface of the ilium between two gluteal lines. So previously it was between the posterior and anterior, and now minimus is between the anterior and inferior gluteal lines. So I'm going to be finding the PSIS and the PIS, and then sinking into our greater sciatic notch here. And as previously found, I'm going to landmark what is known as the iliac tuberculum here and draw kind of a trace line across that. This is my anterior gluteal line. And then deeper inside that greater sciatic notch, and instead of getting at the tuberculum, I'm actually going to drop down off the ASIS into the notch between the ASIS and the AIIS, anterior superior iliac spine and the anterior inferior iliac spine. And this line basically goes straight across from the greater sciatic notch towards the notch in between those two anterior landmarks. So this would be the inferior gluteal line of the ilium. So between the anterior and inferior gluteal lines is the origin. It's going to be deep to gluteus medius. This is not going to be an easy separation. It's more of a superficial palp for gluteus medius, but all of the minimus palp is going to be through medius, so you're going to have to sink down. Gluteus medius attached to the external surface of the greater trochanter here, but minimus is more on the superior aspect. So again, if you need to, you can utilize the leg to help you landmark. So what I like to do is add a little bend in the knee, and then I'm going to lift up and down on the ankle, and you can easily see the greater trochanter moving underneath the surface here. So that will help you find the greater trochanter. So I have the anterior and posterior borders, but now I want to find the superior border. So basically you follow up on bony resistance until you start dropping off, and that will give you the superior aspect of it. So this is the insertion of gluteus minimus, which means it's a much smaller muscle in comparison to gluteus medius. Minimus is more of a stabilizer, but it is definitely involved in abduction of the acetabulofemoral joint. So where I was palpating a little bit higher and a little bit broader for medius, I'm going to sink in right above the superior aspect of that greater trochanter, and I'm going to ask for more of a pure abduction. Great. Let's bring the leg back down again. So once the leg is relaxed, you can see I'm sinking in quite a bit here. And then as soon as my partner starts to lift her leg up, I'm going to be pushed right out. And again, as we relax completely again, then I'll get a nice sink back inside the belly. And then again, as she abducts, you get pushed out. It is definitely going to be hard to determine what is medius versus one is minimus. But one thing that I like as your palpation skill improves is you should be able to tell the difference between one layer of muscle, which again, this is just medius. But as you get closer to that greater trochanter, it's going to feel denser. It's going to feel a lot thicker. And that is because we're going through 2 layers of muscle now. So again, sinking in just above that greater trochanter for minimus. Minimus has very similar functions to medius, but as I said, because a lot of its fibers are more straight up and down, we're going to focus heavily on abduction instead of with medius we did abduction, external rotation, extension. So that is going to conclude our palpation of gluteus minimus. We're going to be palpating the muscle piriformis. We're going to be finding the origin along the side of the sacrum. Now, piriformis does actually originate on the anterior surface of the sacrum, but I'm not going to be able to palpate that. So we're going to get as close as we can going through what is known as the greater sciatic notch. So let's review that a little bit and how we get ourselves there. I first landmarked the PSIS, posterior superior iliac spine. I'm going to move inferior from that. And the next, it's not really a bony landmark, but last part of bone that you'll feel before you drop into a significant soft spot is PIIS. So PSIS, move inferior, PIIS, and then drop down into the greater sciatic notch. Now, you can feel the lateral edge of the sacrum, so I can go on the sacrum and drop off. This is softer as we kind of sink into this tissue here. And this is going to be as close as I can get towards the origin. So I'm going to be moving and grabbing an ankle now so that I can kind of lift it up. And for this, we're going to try to activate the belly. And the main function that Piriformis is doing is it's taking the femur and rolling it towards the sacrum. So in this case, that is going to be lateral rotation of the acetabular joint. So you're going to go back to as close as you can to the origin, just past that sacrum. I'm going to put some pressure to the inside of their ankle here, and they're going to contract and relax. And then I'm going to move a little bit further over and start to sink in, and again go through that same activation. Now the action again is external rotation, but the muscle that you're going through is gluteus maximus. Medius is going to be above piriformis, and you're going to have to sink through basically maximus. Unfortunately, glute max also does external rotation, but if I let her do this forcefully on her own, you're not seeing a huge contraction of gluteus maximus versus if she was to lift her leg up off the table, that's definitely going to fire off glute max. So by keeping the leg as flat on the table as possible, sinking through gluteus max, and then having them do just the rotation should allow you to feel the piriformis muscle. Please be warned as you're palpating, especially close to the origin and deep in the belly, the sciatic nerve is exiting out underneath piriformis, so people might experience some tenderness, especially in this area if you're pushing too hard while you're palpating the belly. A lot of people spend a majority of their day relaxed in an externally rotated position as well, so they might find that it's uncomfortable with deep palpation on it. I've slowly worked my way from medial to lateral, and I keep using the leg as a lever. What I'm actually trying to do is feel the movement of the greater trochanter. So I'm starting to pick up that movement of the greater trochanter right now, and I'm trying to feel kind of that superior aspect for the insertion of piriformis. Again, I'm going to ask for her to do some external rotation. Good. I'm going to bring the leg back down and go towards my origin again. So if you take a look from origin towards insertion, piriformis does go primarily lateral, but almost on a very slight inferior oblique angle. So again, from O towards I on that superior aspect of the greater trochanter, the femur. Because of that, in this neutral position, piriformis's one big action is going to be external rotation as it rolls that femur posteriorly. But if we change the angle, which we won't be able to do from this position, if you start to flex the leg up towards 90 degrees, it actually turns into a horizontal abductor and slight internal rotator. So it's worth mentioning. However, while your person is in prone, the only action that you can use to fire it off is going to be external rotation. This is going to conclude our palpation for piriformis. Okay, we're going to be palpating the external rotators of the acetabular joint. So we're going to do this as a group and slowly work our way from superior to inferior all the way down. We've already discussed piriformis, so we're going to be starting at the next muscle in line, which is going to be the superior gemellus. For the superior gemellus, we're going to be landmarking a bony landmark known as the ischial spine. So for that, I'm first going to be palpating at the bottom, looking for the ischial tuberosity. So I'm going to be taking the palm of my hand and I'm going to be pushing into the low aspect of kind of where your sits bones are, where you're kind of sitting on this area. So this is your ischial tuberosity and the origin of your hamstrings. And I'm going to curl my finger just to the inside, like so. Again, being mindful, not going too central in this case, avoiding genitalia and an uncomfortable hand location. We're going to be going straight up along this aspect here. Okay, so again, ischial tuberosity rolling just to the inside, palpating up, and I'm going to get to a point where it feels like it wants to turn or angle heading towards our sacrum, and this is the ischial spine right here. Just for clarity, I'm going to show you on the sacrum as well. If I'm going down the lateral aspect of the sacrum. Here's the inferior lateral corner of the sacrum. So we should have about an inch and a half of separation between the ischial spine and this inferior lateral corner of the sacrum. So this is the location where superior gemellus is originating. It's kind of that lateral part of that ischial spine, and the muscle is going straight lateral in fiber direction and attaching onto the greater trochanter. So again, I'm just going to sink in on the side here. Here is our greater trochanter. Now, if you think of the greater trochanter kind of like my fingers at the moment, we have a superior and a posterior. Well, it's actually attaching on the inner surface of the greater trochanter. So it's the medial aspect of the greater trochanter. So not kind of top, anterior, posterior, superior, but the inside of it. This is not going to be an easy muscle to identify through activation, since a lot of the external rotators all work as a group and they all do the same action, which is external rotation. So I am going to sink in and then grasp the leg and lift it up and ask for that same external rotation. If we're bringing the leg across the body, go ahead. And I'm going to strum gently up and down, but I'm not expecting to be able to easily identify the difference between piriformis versus superior gemellus and the other external rotators. It's going to be quite tricky. So more so being comfortable with your bony landmarks and that you're going from, again, ischial spine towards greater trochanter. Okay, the next muscle in line is going to be obturator internus. So I'm going to be starting at the bottom again, our ischial tuberosity. In this area, I'm going to turn my hand and then I'm going to again sink. I'm actually going to switch hands here just to make it a little bit easier. So ischial tuberosity, hook my fingers like so, and I'm going to travel up a little bit, and just below that ischial spine, which we palpated here, this is going to be where the obturator internus comes out from inside the medial aspect of the ischium and pubis, and what is known as the obturator foramen. So that is really deep. I'm not going to actually be able to get fully on the origin, but I'm hooking my fingers in towards that foramen as best I can, but you're not going to be able to make contact with the whole thing. At this point, it exits out, going over top of the ischium, just below its spine, and just like superior gemellus, travels laterally and inserts in a similar location in that medial aspect of the greater trochanter of the femur. As I said before, you're not going to be able to distinguish this muscle away from superior gemellus or inferior gemellus, so it is about trying to get the correct O to I. And when you treat these muscles, you're treating them as a group anyways. So obturator internus. We actually do not palpate obturator externus, so the next muscle I'm going to be looking for is inferior gemellus. For inferior gemellus, I'm going to be starting by finding the ischial tuberosity. And instead of going medial this time, I'm actually going to go lateral. So I'm going to go along that ischial tuberosity, staying to the lateral aspect of it, and go a little bit higher. It's probably going to be about an inch and a half. So again, here's the bottom, rounding to the lateral and outer aspect of the ischial tuberosity and traveling up. And on that external surface of the ischial tuberosity is going to be the origin of the inferior gemellus. With my other hand, I'm going to be palpating for the greater trochanter again, and I'm going to be trying to hook that internal aspect of it. So in this area from O to I, we have the inferior gemellus. So I'm going to be doing a little bit of a cross fiber strum of the approximate location of this inferior gemellus, like so. And the final one in this group is going to be quadratus femoris. So quadratus femoris is a more palpable muscle than the previous three. So again, I'm going to start with the origin of quadratus femoris, sometimes shortened to quad fem. I'm going to be finding, again, this inferior aspect of the ischial tuberosity, And like inferior gemellus, I'm going to go to the outside and start to work my way up. And I'm going to stay kind of right at the bottom. So here is the ischial tuberosity, and here's more just lateral to it. This is the origin right here for the quadratus femoris. Now this muscle is quite small and ends up taking on kind of a cubed shape. So as you head lateral, and if you were to sink in and go up and down, there's going to be quite a tight ropey muscle band right in this area right here. So this is the palpable quadratus femoris. And instead of being on the internal surface of the greater trochanter this time, it actually attaches on a landmark that's just below that. So this landmark has two names depending on your reference. I'm going to find greater trochanter. I'm going to go towards that posterior aspect of it. And as I start traveling inferior and medial right in this area, this landmark is known as the intertrochanteric crest, but specifically the muscle attaches to what is known as the quadrate tubercle. So quadratus femoris to the quadrate tubercle of the femur. So we have an origin right here on that lateral aspect of the ischial tuberosity and an insertion here on the quadrate tubercle. Now, because this muscle is quite low in this group, where you had piriformis somewhat turning into a horizontal abductor, towards the bottom, quadratus femoris turns into an adductor. So besides external rotation, it can also help pull the femur in. So let's just activate this last muscle in the group. I'm going to point out just a pretty obvious landmark here. If you looked for a gluteal fold, so kind of right at the bottom of that glute fold, that's where it's quite easy to find the ischial tuberosity. You move slightly lateral to that, you sink in, you go up and down, and then you ask them to try doing that lateral rotation. This is an almost guaranteed find for the quadratus femoris muscle. So right inside here. Oftentimes people say it's as thick as it is wide, which makes it kind of look like a cube because it is quite short in its dimensions, but its thickness is actually quite dense. All right, this is going to conclude my palpation of the external rotator group. We're going to be palpating biceps femoris, so which is going to be in our hamstring group. Biceps femoris is the lateral two bellies versus semitendinosus and membranosus more on the medial aspect. So we're going to be starting off by palpating the long head of biceps origin. You can take the palm of your hand and kind of push in like so. If not, kind of find just the bottom of that gluteal fold where the ischial tuberosity is going to be. The ischial tuberosity of the ischium is going to be the origin for all three hamstrings, but for biceps femoris, it's just its long head. So what I'm going to do next is I'm going to activate this muscle. So I'm going to have our body just lift their leg up. Hamstrings are primary knee flexors. So yes, it does act on the acetabular joint doing extension, but if they were to lift their whole lower extremity up, you're going to get a lot from gluteus maximus. And I'm trying to keep glute max out and more focused just on the hamstring itself. So let's lower the leg back down again. Just bring this up. We're going to change our palp. I'm going to push down on her leg, and this is going to activate what almost kind of feels like a common tendon right here. So it's going to be really hard to distinguish the difference between biceps femoris, semitendinosus, and semimembranosus, especially up at their origin, because they do start blending together and almost overlapping. So what we're actually going to do is go down to the distal end of the muscle, and then I'm going to start to work my way back up. So we're going to turn the leg a little bit here, and I'm putting this on a slight angle so that we can kind of get this tendon of biceps femoris to stick up. I'm going to add some resistance to that knee flexion, and right in this area right here is going to be our easy to find biceps femoris tendon. So I'm actually going to follow it down. It's crossing the knee joint, and it's inserting into this head of the fibula right in this landmark here. So I'm able to easily grab and kind of maneuver that, as well as it goes a little bit wider than that, going onto the lateral tibial condyle. Okay, so head of the fibula, lateral tibial condyle, are our insertions. The long head is very tendinous on this lower aspect. I'm able to kind of cross fiber and strum. And once I get a little bit higher, it's going to turn more into a muscle belly. So I'm going to add, again, a little bit of resistance. Good. And what I'm doing here is I'm actually trying to separate the semitendinosus and membranosus, which are over here, more from the biceps femoris, which are on this side. So as I follow up specifically biceps femoris on its long head, it's going to get harder to pull apart as we work our way up. So I'm going to turn more to a strum, and that's going to take us all the way up to the ischial tuberosity, right in this area here. Now for the short head, I need to slacken the long head. So what I'm actually going to do is first ask permission to put my knee up on the table. I'm going to bend the knee up. I'm going to be placing my knee here to actually slacken the muscle. So I'm adding a little bit of a bend. I'm going to rotate the leg out a little bit. So once I've found this long head tendon right in this area, I'm actually going to be trying to go underneath it. So here's our long head tendon. I'm going to just pull up into my hand. Perfect. Right here, I'm going to go underneath the long head, get her to relax, push the long head over, and try to get my fingers down onto the posterior aspect of the femur. The short head is going to be originating here along the linea aspera of the femur, which is a posterior landmark. And I'm just kind of above the lateral supracondylar ridge of the femur, and then up along this posterior lateral lip of the linea aspera. There's a little bit of an argument about how much of the femur the short head covers, but I'm probably going around 3/4 of the way up the femur here, showing the attachment for the short head. So again, if I have my partner to bend her knee up, this is me grasping the long head component of it, and then I go to the side, get her to relax, and I push that long head out of the way as we drop down as best we can underneath. So the short head is underneath the long head. So again, long head originating off the ischial tuberosity, short head off the posterior linea aspera, and both heads are going to be inserting down into the head of the fibula as well as the lateral tibial condyle of the tibia. That is going to conclude the palpation of biceps femoris. We're going to be palpating the muscle known as semitendinosus, which is one of your 3 hamstring muscles. So we're going to be talking about its origin towards its insertion. So I'm going to be starting up at, again, the origin. So I'm going to be sinking in just below the gluteal area and finding what is known as the ischial tuberosity of the ischium, which is right in this area. And then I'm going to fire off the hamstring's main function, which is going to be flexion of the knee. So I'm going to ask her to lift her leg here up. Good. There's a common attachment up at this location here where biceps femoris and semitendinosus are really kind of connecting together and originating at this ischial tuberosity, which is going to make it extremely difficult for us to separate them. So for that very reason, I'm actually going to be going down towards the insertion, finding that, and then working my way back up towards the origin, because it's going to be easier to split the hamstrings apart once I can identify where tendinosus is. So tendinosus has a very nice, obvious tendon for us to find. So just above the knee, if you place your fingers flat and you ask a person to give some resistance into knee flexion, this is going to be a very easy to find and identify tendon, which kind of helps with its name, semitendinosus. So you have a nice round thin tendon, and what you can see right here is there's almost a subtle groove in the tissue. So semitendinosus, its insertion is actually on the anterior tibia, so I'm cross fibering and strumming, and this tendon is wrapping around towards the front of the leg into a landmark known as the pes anserine. Now I'm going to show a different reference point here. So we're looking at the tibia from a slightly different angle. But if I slid up that anterior border, this is our tibial tuberosity right here. If I follow that superior and medial, this is our condyle. And just below the condyle on the medial surface, there's 3 muscles attaching in this area. And those are Semitendinosus, Gracilis, and Sartorius. So Semitendinosus is going to be attaching just in this area here. Again, I'm going to have her hold her own leg up for me, and I'm going to follow that tendon around the posterior aspect of the leg into this insertion here. Sometimes people refer to it as PAM, or the proximal anterior medial shaft of the tibia, or again, the pes anserine insertion site. Okay, let's go back to our tendon. I've identified our tendon again. Don't strum it too aggressively, but you are going to want to follow it up. And since it is tendon for quite a bit of the more distal half of this muscle, you're going to go tendon, 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 working your way up until it finally starts turning into more of a muscle belly, which I'm starting to feel that musculotendinous junction in this area here. So as we switch over from tendon into muscle belly, I'm going to ask for some resistance. Good. And now I'm going to try to grasp and follow the muscle up. So trying to stay off of biceps femoris, which is on more the lateral aspect. I'm going to follow up as best I can, sticking to semitendinosus. And then, as I said previously, as we get really close towards the top, it's going to blend with biceps femoris as they both are attaching here on that ischial tuberosity. So this is the origin of the ischium, and the pes anserine was the insertion at the bottom part. Again, just as a reminder, it's doing a lot of flexion at the knee, but it also can do some extension of the acetabulofemoral joint. So that's going to conclude our palpation today for semitendinosus. We're going to be palpating the muscle known as semimembranosus. I'm going to be starting by finding the ischial tuberosity of the ischium, so just below the gluteal area, sinking in, so right in this area here. Now, what's interesting about semimembranosus is I'm putting 2 fingers down to kind of indicate the biceps femoris as well as semitendinosus, but membranosus actually comes underneath both of them and heads out a little bit more lateral than that. So let's try to draw it this way instead. So semimembranosus being underneath, it actually travels deep to those 2 tendons, still to the ischial tuberosity, but a little bit more sunk in deep and lateral to the 2 previous ones. So it's going to be really challenging to separate where semitendinosus, biceps femoris versus semimembranosus. So we're actually not going to. You're really going to treat these as one attachment for the most part, but you might have to do various deep techniques across that whole area. Because it's really challenging to separate the origins, we're going to look more at the distal attachment instead. So I'm going to jump down to the lower half and into that distal attachment. First thing I'm going to do is identify semitendinosus. So as I'm just gently strumming back and forth, my partner here is holding her own leg up a little bit, so it's making it easier for me to feel this tendon. So if I can identify semitendinosus, what you're going to do is drop on either side of that tendon. So I'm widening my grip. So again, tendon right here, about this big. You're going to widen on both sides and then sink in. So if you can sink in underneath semitendinosus, is quite a large semimembranosus. So I'm trying to show you that I'm underneath the first layer, I'm sinking in with pads, I'm going back and forth, and I can feel quite a bit of resistance from a muscle. Let's just orient ourselves straight for a moment. So we have semitendinosus on top, we have semimembranosus underneath that, and over here on this side is biceps femoris. So I'm sticking away from biceps femoris, kind of going more in the middle of the knee and grasping a little bit deeper and a little bit wider. For semimembranosus, it's going to be inserting onto the posterior aspect of the tibia. So you're following this across the posterior knee joint and inserting right into the back of the tibia. So we have two names for this. We could call this the groove for semimembranosus, which is a horizontal groove on the back of the tibia, or you could just say it inserts onto the posterior medial tibial condyle, which is where that groove for semimembranosus is. Again, I'm going to ask you to hold your own leg up in the air for a minute. Great. And I can quite easily feel that muscle inserting. This is going to be deep to kind of gastrocs, but it's above the soleus muscle. So you should be able to kind of sink in here and feel that attachment for semimembranosus. Okay, I'm going to start following this muscle up. Again, it's underneath semitendinosus. So while semitendinosus is in its tendinous distal form, you're going to easily be able to separate the two. But as we get up more into the proximal half, it's going to be really challenging to try and separate semitendinosus and membranosus. However, semimembranosus is a little bit closer to those adductors because it is deeper. So I'm just going to roll the leg out a little bit. So this is the adductor group right in here. And I'm going to ask for her to hold her own leg and push up into me with a little bit of force. So right in this part here, I can actually start separating the adductors from the hamstrings. And while you're sinking in along that edge close to those adductors, you're finding primarily only this muscle semimembranosus. So I'm going to be following that up, right up towards that ischial tuberosity. And as I said, it's going deep to the other two before it originates on that ischial tuberosity. So as you're palpating on the medial hamstrings, you're inevitably grabbing both semitendinosus and membranosus. But if you're treating right up against the adductor group, this is primarily more of a semimembranosus palpation. Semimembranosus and tendinosus and biceps femoris are all doing the same actions at flexion of the knee and extension of the acetabulofemoral joint. That's going to conclude our palpation of semimembranosus. We're going to be palpating the muscle known as tensor fascia lata. So we're going to be describing our O's and I's. First thing I'm going to do is look for the iliac crest. So I'm finding the top of the iliac crest. I'm going to follow it all the way forward until we get to the anterior superior iliac spine, the ASIS. And then I'm going to drop off the lateral aspect and work my way up along the external surface of it until I come across the iliac tuberculum or tubercle, and I'm going to leave a finger on that landmark. So between the ASIS and this tuberculum is the origin on the external surface of the anterior iliac crest. So it does not officially attach to the ASIS or the tuberculum when you're reading most notes, but it's actually the origin is on that external ilium in between them. So I like referencing them to kind of get an idea of how wide the muscle is. It has a very bony origin, which we're going to fire this off just to help us identify the muscle belly. And very simply, I'm going to ask her just to roll the whole extremity into medial rotation. Now, as soon as we do that, you'll actually start to get the outer shape of it. Now, if I ask her to lift her leg up off the table, now you're going to get a very defined kind of anterior and posterior border of it. We add the third element is bringing the leg away from her other leg into some abduction. And that, again, is going to really activate this tensor fascia lata muscle right in here. So I have a nice, easy to palpate muscle belly that I will follow lateral. Let's bring the leg back down. So let's repeat those actions one more time. You ask the person to roll their leg in, medial rotation. You ask them to lift it up off the table in flexion and then push out towards you into abduction. So if you ask them to hold and we keep this leg kind of extended or locked, that'll help us identify and activate this tensor fascia lata. Now, all of TFL actually inserts into soft tissue. So as it has a bony origin, It's heading lateral and a little bit more posterior, and then it's going to put all of its fibers into the iliotibial band, or otherwise known as tract. So the iliotibial band is coming down the whole lateral aspect of the leg. It has gluteus maximus inserting into it from posterior, and it's going to have TFL inserting into anterior. So for that, we're going to try to identify where the iliotibial band is. I'm just going to roll her shorts up with permission, just a little bit higher on the side. So we'll just fold it in here. Good, like so. Bring the leg back down. I'd like you to, with a locked knee, lift it up and just push out into me. Good, so you can start to see this indentation that starts to form along the lateral leg. Can you relax your leg for a second? Now I want you to lock your knee as if contracting your quadriceps really tight. That is firing off the quads, but in this case I want you to relax and now just push out into me with that forceful knee. This is not activating the quads, but it is tightening up the iliotibial band. So we're going to follow TFL into this iliotibial band, and then if you'd like to, you can follow the iliotibial band all the way down past the knee joint, easily strumming it as it finally inserts into Gerdy's tubercle here of the tibia. Just to orient yourself for Gerdy's tubercle, I have the tibial tuberosity. I would move along what is known as the oblique line of the tibia, and then I have a round kind of bony object as Gerdy's tubercle right here. So depending on your source book that you're reading for the muscle tensor fascia lata, you might see helps lock the knee as one of its actions, but for the muscle belly itself, we really want to focus on that flexion, abduction, and external rotation of the acetabular-femoral joint. And that's going to conclude our palpation of tensor fascia lata. We're going to be palpating the muscle Sartorius. Sartorius is one of the longest muscle, if not the longest muscle of your body. That's going from the ilium all the way down to the tibia. It's originating on this bony landmark right in this area known as the anterior superior iliac spine of the ilium. And it's going to be going all the way down to the pes anserine of the tibia. The best position for this is going to be palpating it in a figure 4. So I'm going to lift the thigh up. I'm going to put my knee on the table. I'm going to ask her to bend her knee like so. However, when we activate it, I'm actually going to ask her to pick her entire leg, including the portion on my thigh, up off the table and hold it in the air. So you don't have to have your knee on the table. You could actually just ask the person to go through this action and hold their leg up while you're palpating the muscle. So that's up to you. I'm actually going to leave my leg off for now. So at ASIS, I'm going to ask her to externally rotate the acetabulum, slight abduction, and then lift the leg up, which is flexion. So at the AF joint, right off the ASIS, if they're doing this action, you will be able to feel a strap-like muscle that starts to show up right in this area here. And I'm fairly easily able to follow that as it works its way down the thigh. I'm going to give her a chance to relax here for a moment. So the muscle tissue that's lateral to it is going to be the quadriceps, and the muscle tissue that's medial to it is going to be the adductor group, the adductors. So again, I'm going to ask her to lift up her leg and rotate and hold. So right in this area again, I'm around the midway point of it. I'm able to feel the both anterior and posterior border of Sartorius. As we follow it down, it's going to cross posterior to the tibial condyle, and as I mentioned, it's going to insert here at the pes anserine insertion site, which I also like to call PAM, the proximal anterior medial shaft of the tibia. So as it's crossing the knee, it is creating flexion of the knee, but it's also taking the knee and rotating it slightly in a flexed knee. So let's bring this back down again one more time. So it's a fairly complex motion that's crossing multiple joints. Again, one more time, it's doing flexion, external rotation, abduction of the acetabular-femoral joint. which allows you to kind of feel this muscle as it works its way down the thigh. And then it's going to be doing flexion and medial rotation of the leg at the knee joint before it inserts here at the pes or an insertion site of the tibia. That's going to conclude our palpation of Sartorius. We're going to be palpating the muscle Pectineus, which is one of the adductors. So the first thing I'm going to actually ask my partner to do is going to create a border as we go into what is known as a figure 4 position. So she's going to be placing her hand over top of genitalia just to create a border so that, again, no accidental contact is made. We're going to be looking for the origin of Pectineus, which is going to be on the pubis, and specifically the superior pubic ramus on what's something called the pectineal line. So what I have my thumb on or my fingertips on right here is the ASIS, and I'm actually going to go down along what is known as the inguinal ligament, and that inguinal ligament is going to take me right towards the pubic tubercle, which is right here. So I have the pubic tubercle and the ASIS, and again, the inguinal ligament runs along there. From this inguinal ligament and pubic tubercle, we want to drop down into the femoral triangle. So I'm off the tubercle and the inguinal ligament dropping into the femoral triangle, and I'm going to try to go gently sink into the femoral triangle and then up towards this pubic ramus. Take caution because the femoral artery is in this area, so if you start feeling a really strong pulse, you actually want to be slightly more medial to that major blood vessel, which is sitting around here. Once we are inside this femoral triangle near the origin of the muscle, I'm going to ask my client to do a combination action, which she's going to bring her knee up and bring it across. So almost towards her opposite shoulder. Good, and relax. And what I can feel is a lift as this muscle tissue is kind of lifting my fingers up and elevating it up. So those two actions are flexion and adduction at the acetabular-femoral joint. I'm going to have her do that again, and good. I can feel this nice broad lift that's happening underneath. Pectineus is quite a small muscle, going from that pectineal line of the pubis and inserting into the pectineal line of the femur. So it really is kind of just a small triangular kind of shaped muscle in this femoral triangle. Some people will call this the floor of the femoral triangle because it's not on the surface, it's actually quite deep within it. So I'm going to head lateral and inferior, and I'm going to try to find the femur in this area. Another way to think about this is it's going to be inserting just below the iliopsoas tendon, which is coming down into the lesser trochanter of the femur. I'm going to bring her leg down for a moment. She's going to just keep her hand where it is. So if I drop off the ASIS and inguinal ligament, just below that, but now lateral to my pulse, this is close to that iliopsoas hip flexor muscle, and I'm going to get her to just lift her knee up towards her chest. Good. So what I want to do is again bring her back to that figure 4 and go just inferior and a little bit deeper to the lesser trochanter. And again, I'm going to ask her to bring her knee to her opposite shoulder for me. Good. And right in this area, I'm feeling that small lift. If you can't get all the way to the pectineal line of the femur, that is okay. But again, we're really looking for a small muscle in this kind of quadrant right in here. So that is going to conclude our palpation of the muscle Pectineus. We're going to be palpating the muscle adductor longus. So the first thing I'm going to do is bring the leg up into what we call a figure 4 position. So I'm going to bring the foot up towards the knee. I'm going to put my knee on the table, and then I'm going to drop the leg towards myself. So this puts the adductors in a bit of a shortened but also kind of lengthened position, but it gives me access to the inside of the thigh. So this muscle is a flexor and adductor, so I am bringing it up into flexion. And now when I ask her to activate it, all she's going to have to do is bring her knee towards the center of her body. So again, adductor longus is going to be originating on the pubis. So for this, I'm going to ask my partner here to border. So she's going to place her hand over top of genitalia, creating a border for me so I do not cross and accidentally make contact. And I'm going to then follow up what I believe is the adductor muscle towards the pubic bone. So I'm placing my hand in that proximal aspect of the medial thigh. I'm actually going to switch hands for a second. And I'm going to take my other hand and place it on the inside of her knee and ask her to bring her knee across her body. And what I'm going to feel is a muscle that starts to lift up right in this area here. Great. Now there may be two muscles that lift up, and it might actually feel like one large one. So if that is the indication with your person that you're palpating on, it's the first one. So if you're starting from anterior and working your way back, it's going to be the first muscle that's lifting up. So this is adductor longus, and I'm going to follow adductor longus up towards the bordering hand until I make contact with the body of the pubis. So my middle finger right here is currently on the tendon, just gently going back and forth, and I can feel a bony object right there. If she gently starts to bring her knee across her body, good. My finger's are going to get lifted up, and then it drops back down. So this is the origin of adductor longus, the body of the pubis. Again, we've already found a little bit of its muscle belly. We can follow that down. You can use a grasping motion, and I'm going to get her to lift up and hold for a second. Good. And as I work my way down the thigh, I'm actually going to start to lose it, and that is because it's starting to go down towards its insertion. So it's fairly superficial in the mid-belly and towards the origin, but as it works its way towards the insertion, it's going to start to go deeper and dive towards the femur. Go ahead and relax. So as she relaxes, I'm going to sink my fingers and hook them towards the femur. And if you look, I'm approximately halfway down the thigh. So our insertion is the middle of this linea aspera, which is on the posterior aspect of the femur. So you might call it the medial lip of the linea aspera. And again, that's midway down. So that is going to be our insertion. Again, one last time, this muscle is doing flexion and adduction as its two primary actions, but some textbooks will also reference a rotational component. I'm just leaving that out for now. That's going to conclude our palpation of adductor longus. We're going to be palpating the muscle adductor brevis. So if you've already watched the adductor longus, I'm going to be using the same figure 4 position. I'm bringing the leg up, allowing it to rest on my thigh, and I need to identify where adductor longus is to be able to find adductor brevis. So if you haven't already watched the adductor longus video, I'm going to suggest watching that first and then watch the adductor brevis one. What I'm going to ask is for her to create a border with her hand. So she's just going to create a border so that I don't make any accidental contact. I'm going to ask her to bring her knee towards her opposite shoulder and kind of lift it up. I'm going to find where the adductor longus muscle is. So right in this area right here. And now I have two options. However, I prefer one, so I will show you both, but just which one I prefer. Adductor brevis is underneath adductor longus. It is not an easy muscle to palpate. It is not an easy muscle to identify. Even some of your books, you have to basically remove some of the more superficial muscle tissue. So what I need to do is find in this case, I'm going to use the posterior border of adductor longus. So again, I'm going to ask her to lift her leg up to cross. Here is that muscle tissue. I'm going to find the posterior border. She can relax. And I'm going to try to hook adductor longus sinking in and trying to almost get underneath it. So if you can imagine my fingers as adductor longus, I'm going to hook and try to go deep to underneath this adductor longus to try and activate and feel brevis. This is not going to be an easy palpation, so this is not going to be a really easy one to go from O to I. So again, I'm going to hook my fingers and try to sink underneath, and now gently ask her to adduct her thigh. Good. And I can feel longus right up underneath here, but deep to my fingers, I'm feeling another muscle tissue underneath this. Adductor brevis is going to be originating on the same pubis as adductor longus, however, again, deeper to that. So still the body, but also a little bit of the ramus, which is a little bit more posterior to the body. And instead of going into the middle part of the linea aspera, it's actually going to be inserting more proximal, because its name again is brevis. So it's on that medial lip of the linea aspera, just more proximal up it. So in that proximal 1/3 of that area. Again, a very gentle adduction for me. Good. And relax. So quite a small muscle, still one of the adductors in the group, but it's not going to be a really easy one to identify through palpation. That's going to conclude our palpation for adductor brevis. We're going to be palpating the muscle gracilis, which is one of our adductors. As previous adductor videos, we're going to be bringing the leg up into a figure 4. However, gracilis is a bit of a unique one of the adductors because it is the only adductor that actually crosses the knee joint. So before we go further into the palpation, I'm just going to show my partner here the action. Because it's the only adductor that crosses the knee joint, what I'm going to ask her to do is drag her heel along the table up towards her glutes, which is going to add in some knee flexion, or you're going to have your person dig their heel into the table, and that's going to start to raise up the gracilis muscle. So if she relaxes for a second, and you kind of look just in this area where my fingertips are, and again, go ahead and dig into it. So right in this area, here is our gracilis. Okay. So gracilis is sitting just posterior to the adductor longus on the superficial muscles in these adductors, but if you reference it, it is considered the most medial muscle of the thigh. So another way to help us identify where gracilis is, I'm going to start off by looking for adductor longus. So I'm going to place one hand on the inside of the knee, I'm going to place the other hand just above the medial thigh, and ask her to raise her leg up. So right in here, this is adductor longus in this location, but if I go right below that, and I'm going to sink in with some weight so you can see my hand move, and I ask her to dig her heel into the table, go ahead, and there we go. There's the lift from gracilis. But because she's only moving her knee, this is definitely not adductor longus, which doesn't cross the knee. So again, if she flexes and digs her heel in the table, this lift that you're seeing happen and relax going down is happening from the adductor that crosses the knee. Okay, for us to get closer to its origin, I'm going to ask her to border like you've seen in previous adductor videos. So she's just creating a border for me. I'm going to be asking her to dig her heel into the table. Good. And I'm going to follow this strap-like muscle up towards its origin, which again is on the pubic bone. I'm going to ask her to relax. So I'm right next to the pubic bone. I'm just going to sink in and ask her again to drag her heel a little bit. Good. And there's our lift and back down. So this is the inferior pubic ramus, as well as a little bit of the body of the pubis. And those are the origins for this muscle. Again, if you would dig your heel into the table and just hold that for me, I'm going to follow this superficial strap muscle down the medial thigh. And then it's going to start to blend in with two other muscles. So from anterior, we have Sartorius, and from posterior, I have Semitendinosus. And those three muscles are basically this group right in the medial part of the thigh right here. So gracilis is in the middle of those two. So I'm going to ask now that you try to do a adduction with this knee for me, bring it across your body. Good. And that's going to eliminate some of the semitendinosus and sartorius function, where they're all three of them together. And as I cross, I'm now crossing the knee joint right in this area here, the condyle of the tibia, and just below the condyle of the tibia, this is the insertion of those three muscles which make up the pes anserine insertion site of the tibia. Another thing that I like to call this is PAM. So if you've heard any of the previous videos from me before, I call this PAM, which is the proximal medial anterior surface of the tibia, but it is the pes anserine insertion site. So with all of those functions together, we are having adduction and flexion of the thigh, as well as you will have flexion and a slight medial rotation of a flexed knee at this knee joint. And that's going to conclude our palpation of Gracilis. All right, we're going to be palpating the muscle adductor magnus. So for adductor magnus, this is one of the largest adductors that's taking up a large portion of the thigh and more of the posterior aspect of the thigh. It has two separate heads that kind of go along with it. So we're going to be palpating numerous origins and a couple different locations for our belly. The first thing I'd like to do is try to orient ourselves versus the muscle that's just behind it, which is going to be Semimembranosus. So for this, what I'm actually going to ask her to do is she's going to bend her knee and she's going to dig into the outside of my thigh here. And while she's doing that, she's activating the hamstrings and not adductor magnus because it does not cross the knee. I'm going to follow Semimembranosus and tendinosus up until I find their bony origin here on the pelvis, which is the ischial tuberosity. So I can feel the ischial tuberosity of the ischium right here, but that's actually one of the first origins of adductor magnus as well, the posterior head. So I'm going to go slightly anterior to that hamstring, and this time I'm going to ask her to try and lift her full lower extremity up off the table like so, and go ahead and bring it back down. And I don't need the full off the table. I'm just going to ask her to lift up. Great, and that's enough right in there. I'm providing some resistance at her femoral condyle, and I can feel magnus activating, and you can relax back down. So again, if you flex the knee, that's going to be a hamstring, and relax. But if we lift the knee straight up, that's going to be magnus, which is slightly anterior to those hamstrings. From here, we're going to head anterior along the ischial ramus and then onto the inferior pubic ramus, which is more the anterior head's origin. So it's a bit of a broader fan-shaped muscle at its upper origin. Again, I'm going to ask her to very gently start to lift her leg up. Good. And my fingers are easily raised up and off. One thing, please note, as we're going for this origin near the pubic bone, you're going to be sinking into the thigh musculature and then push up into the bony object. Please do not just push straight up, otherwise you're going to place your hand in inappropriate areas. So again, sinking into the muscle tissue and then up into the ischiopubic ramus of the ischium and pubis. So there's our origin all along here. And then the muscle is basically going to create a little bit of a bend and a twist and start inserting all along the femur. So in that proximal end, if this is our semimembranosus, I'm going to go just anterior to that. Again, I can ask her to kick her heel in. Here's semimembranosus and relax. I'm just anterior to that. And I'm going to slowly sink all the way down towards the femur. Take caution, this can get quite sensitive. And then she's going to raise her leg up. And as she does that, I'm going to get lifted up out from that location. Good. So the more proximal end, this has a small attachment on the gluteal tuberosity. It attaches all the way down along the linea aspera as we work our way down the femur. And then towards the bottom, and again, depending on the body, and this doesn't have to be perfect, but there's going to be a gap where it does not actually attach. So we have all the way along the linea aspera of the femur and possibly a little bit of the medial supracondylar ridge, but then there's going to be a gap space, which is for the adductor hiatus. So this is the end of one of the head attachments. Then there's a space, and then the other head attaches here at what is known as the adductor tubercle. A way to find the adductor tubercle is to find the condyle, the medial condyle of the femur, the most medial location of it called the epicondyle, and then I'm going to hook my fingertips up onto the medial supracondylar ridge and go back and forth in an anterior posterior direction, and I will be able to strum the most inferior part of magnus. If I also ask my partner here to lift her leg up, good, right there, I can actually feel this lower tendinous attachment going into that adductor tubercle. Adductor magnus has several actions, but the reason why we picked this specific position is it's one of the only adductors to do both extension and adduction. It does do some flexion, it does extension, and it does a lot of adduction of the acetabulofemoral joint, but it does not cross the knee. That's going to conclude our palpation of adductor magnus. We're going to be palpating the muscle rectus femoris. Rectus femoris is one of the 4 quadriceps of the anterior thigh. It's going to be having two origins actually on the ilium up in this area, and then obviously it's going to be going all the way down to the tibia as a part of the quadriceps group. We're going to be starting off by finding its origin. So the first thing I'm going to be doing is looking for the anterior superior iliac spine, the ASIS. However, rectus femoris is going to be originating just a little bit below that on the anterior inferior iliac spine. Now there's 2 muscles in very close proximity to the origin of rectus femoris, so I'm actually going to be utilizing both of them to help me identify where rec fem originates. Slightly more medial to it, off the ASIS running this direction, is Sartorius, and slightly more lateral to it, heading off the iliac crest, is going to be the muscle known as tensor fascia lata. So what I'm going to ask her to do right now, I'm going to have my fingers on ASIS and go just a little bit inferior than that, is I'm going to have her roll her leg out towards me, doing lateral rotation, which will fire off Sartorius here. I'm going to leave my finger, and then I'm going to have her roll her leg into medial rotation, which is going to be firing off the muscle tensor fascia lata. So my finger is currently in between TFL and Sartorius, just a little bit below the ASIS. And for some people, they like to use a 3-finger roll. 1 finger is on ASIS, 1 finger in the notch, and 1 finger below that on the anterior inferior iliac spine. Now, I believe I found a nice little ropey band underneath this, which should be the tendon of rectus femoris. So what I'm going to ask my partner to do, instead of activating rec fem at the AF joint, I'm going to ask her to lock her knee, engage the quadriceps, perfect, and that tendon has tightened up a little bit. Hand relax for me. So what that's going to do is not fire off tensor fascia lata or Sartorius, but it will create tension through rec fem. This is one of the 2 attachments and probably more the primary, again, the anterior inferior iliac spine, but it does have a second non-palpable head called the reflected head, which is off the brim of the acetabulum. As we go for the palpation of the muscle belly, what I'm going to ask my partner to do is lift her leg up in the air, including the foot off the table, and hold it in this area for a moment. What you're going to be able to do is rec fem is flexing the AF joint, but it's also helping hold the knee in some extension, which is stopping the foot from dropping to the table. And I can then grab the muscle tissue that's sticking up on the top of the thigh and follow it down towards the patella. If I was to ask her to drop her leg and just lock her knee, what's going to happen is it's going to fire off all of the quadriceps, which is going to make it a little bit challenging to feel the difference between vastus lateralis, medialis, and rec fem. So again, if I hold the leg up in deflection and not in a full contracted position, it makes it easier to feel rectus femoris, and you can get a better sense of where it's starting to end. We're going to bring our leg down. So the muscle belly is starting to end around here, and then it turns into quadriceps tendon, which is going into the base of the patella. And then depending on your reference, ultimately it's going to go into the tibial tuberosity of the tibia via either the quadriceps tendon continuing or the patellar ligament, like I said, depending on your reference source. So we have both origin and insertion of rectus femoris. And again, one more time, it's doing flexion of the acetabulofemoral joint while it helps extend the knee joint. We're going to be palpating the muscle vastus medialis. As a preference myself, I'm going to actually start with the insertion of vastus medialis and work our way up towards the origin. So the first thing I'm going to be doing is identifying the patella bone, which is right in this area here. and I'm going to be feeling more the medial aspect or medial border of the patella, and now I'm going to ask my partner here to lock her knee. Great. So right along here, we have the insertion, as well as a little bit more inferior than that. You can relax on this object right here, known as the tibial tuberosity, via the patellar ligament or quadriceps tendon. Go ahead and lock your knee again one more time for me. Perfect, right in this area. So these are the two insertion points, the medial aspect of the patella and the tibial tuberosity. Now for the muscle belly, it's often described as having a teardrop-shaped muscle. So you're going to see the predominant muscle belly in this area here. So you can go ahead and lock your knee for me. Great. So right in this area, this is the most visible, palpable part of vastus medialis. However, it actually extends quite a bit up towards the intertrochanteric line. The first or lowest of the origins, I'm just going to be hooking around towards the back side of the femur. And again, I'm going to ask her to contract her quads. Good, I get lifted up and off. This right here is the medial supercondylar ridge of the femur. Now I'm going to go up, basically pushing down Sartorius and hooking my fingers towards the back of the femur. I'm not getting all the way onto the back of the femur, but I am trying to indicate that its origin is on the posterior femur on the medial linea aspera. I'm going to continue following that all the way up. I'm going to ask her to contract her quads for me. Good. I get lifted up and off. And I'm going to follow up in a very similar pathway to Sartorius, which is then going to be pushing away these adductors and keeping the quadriceps on this side. We're going to go continue working our way up. Again, can you lock your knee for me? Good. And relax. So if you can recall from Sartorius, or if you've watched the previous video, Sartorius is actually flexing the knee. So I will not be feeling Sartorius as I ask her to, in this case, extend her knee. Go ahead and do that. Good. So right here is rectus femoris, but I'm going medial to rectus femoris and deeper to rectus femoris. I'm going under and a little more medial. And when she locks her knee for me, my fingers get lifted up and then out. Good, like so. The highest origin of this muscle is going to be on what is known as the intertrochanteric line. Go ahead and lock your knee for me one more time. Good, and relax. And that's in between basically the greater and lesser trochanter, the femur, which is running on an oblique. So this is more the medial part of that intertrochanteric line. And one last time, just lock your knee for me. Great. So these whole area has these three attachments: intertrochanteric line, medial lip of the linea aspera, and the medial supercondylar ridge. And that's going to conclude our palpation of vastus medialis. We're going to be palpating the muscle vastus lateralis. Like the other quadriceps, I am going to be starting at the insertion of it, which is going to be here at the tibial tuberosity of the tibia, and vastus lateralis will attach along the lateral border of the patella in this area here. So again, I'm just going to ask her to lock her knee. Good. And I'm feeling a little bit of a pull of the patella in this direction, and you can feel the tightening of that patellar ligament going down into the tibial tuberosity. Vastus lateralis is quite a large muscle. It's basically covering the majority of the lateral thigh, and most of its origin is on the posterior aspect with a little bit wrapping around towards the front at the top. So what I want to do though is get a better estimate of how large it is. We're going to find both its anterior and posterior borders. So the first one is going to be rectus femoris. So in a previous video we've done this. I'm going to have her hold her leg up in the air off the table. Good. And now I can kind of get an edge. So here's the lateral edge of rec fem. I'm going to get her to bring her leg down a little bit, but this time she's going to dig her heel into the table, which is a hamstring action. So then I can get the outer edge of biceps femoris right here. Good. Now I'm going to have her relax her leg down. So what I'm grabbing now is between biceps femoris and rectus femoris. This whole area here is vastus lateralis. So I'm going to squeeze it in between my fingers and my thumb here, and I'm going to kind of push it together, and then I'm going to ask her to lock her knee together, and there we go. I'm getting pushed up and down with that action. Let's do that one more time. So I'm getting pushed in both directions as I'm getting lifted up and getting pushed down towards the table. So it is originating all along this lateral aspect of the linea aspera on the posterior femur. So again, go ahead and lock your knee for me. Good. So I can feel myself getting pushed down here. And as we work our way up the proximal thigh, that lateral lip turns into the gluteal tuberosity. So we can see the gluteal muscles coming in from the side. I'm going to sink in. Again, can you lock your knee for me? Good. So gluteus maximus and vastus lateralis are both attaching to this gluteal tuberosity. We're approaching what is known as the greater trochanter of the femur, which is here. So just below that, the muscle then crosses to the anterior part of the femur, just in front of that. And again, go ahead and lock your knee, and I'm getting pushed off in this direction. So this is the lateral part of the intertrochanteric line. So the lateral part for vastus lateralis, and then you have vastus intermedius, and finally vastus medialis. So right in this location. So we're just lateral to rectus femoris. That puts a lot of our fiber direction for this muscle kind of running on an oblique as it's running down towards the patella and the quadriceps tendon, but some of this is coming from posterior towards anterior, giving it kind of a unique fiber direction as we work our way down. The last thing I just want to point out, this is a common error that a lot of people do, is the iliotibial band runs down the lateral aspect of the leg. If you can lock your knee, but then push out into me for me in this in an abduction. So she's going to push out here. Go ahead. So this right here is the iliotibial band, which means a lot of people think vastus lateralis stops at that band, but that means they're actually missing a large posterior aspect of the muscle. So please don't get confused by the IT band. That's actually over top of vastus lateralis, the muscle. So make sure you've gone past that when you're grabbing the muscle belly. Just like the other two vasti, vastus lateralis is only responsible for extending the knee at the knee joint. So that's going to conclude our palpation of vastus lateralis. We're going to be palpating the muscle vastus intermedius. I'm going to be starting on the distal attachment or insertion of vastus intermedius. So just like the other quadriceps, it is attaching to the patella, the base of the patella, or that more proximal and superior part of it, and then to the tibial tuberosity down in this area here, again through the patellar ligament or the full quadriceps tendon, depending on your reference for that. Vastus intermedius is actually deep to rectus femoris, originating all the way along the anterior surface of the shaft of the femur. So one of the kind of ideas for palpation is if I was grasping the more superficial muscle tissue like this and asking her to lock her knee, good, this would be me grabbing rectus femoris. But if I wanted to get at vastus intermedius, which is deep to this, rectus femoris doesn't actually have an attachment to the femur. So in theory, what I want to do is go on an edge, push rec fem out of the way, and try to get my fingertips deeper onto the bone underneath it. So again, they are going to be fascially bound together. This is not as simple as I'm describing, but you're trying to move the muscle on top over and trying to get to the deeper structure underneath. The other way to think about this is if you're pushing through rec fem through the first layer, you're going to get on a second layer, which is vastus intermedius. Now I'm going to lay my forearm on the thigh just to give you an idea. The femur does not go straight up through the center of the thigh. It actually looks a little bit more like this. So the bone actually goes more lateral, and then the head of the femur is facing into the acetabulum. So as you palpate up the shaft, please make sure you're following it a little bit more lateral instead of going straight up the middle. There's a lot of muscle tissue on the inner thigh and the adductors, but you can actually follow the shaft of the femur up and a little bit more lateral. So deep all the way along the anterior surface of the femur is going to be the origin of vastus intermedius. Basically everything from the intertrochanteric line all the way down just to above the patellar surface. This is all the origin of vastus intermedius, and then again inserts into the patella and tibial tuberosity. That's going to conclude our palpation of vastus intermedius. We're going to be palpating the muscle tibialis anterior compartment of the leg here. So we're going to start up towards the upper attachments and origin, but we are going to fire it off just to help us orient and find fiber direction. So this muscle is a prime dorsiflexor, but it also does a lot of inversion at our subtalar joint. So I'm going to have you repeat that a few times. Great. And I'm going to take a look and just see what I can see first of all. So we can definitely see some muscle orientation and fiber right in this area here. So this is a part of our origin. Okay, so I have the anterior border and shaft of the tibia, and I'm going to drop onto the lateral surface right in this area. This is a part of our origin. As we work our way up, it starts to go just below what is known as the oblique line of the tibia, and it gets onto the lateral tibial condyle. And again, can you do that dorsiflexion for me? Great. And then deep to this area in between the tibia and fibula is the interosseous membrane. And depending on your source, sometimes it talks about the fascia covering over top of it is a part of its origin as well. So the muscle belly is in the proximal half of the leg. Again, I'm going to ask her to hold this up in this position, and as I follow it down around the midway point right in here, I'm losing the belly and it's starting to turn to a tendon. So this is muscle belly versus the rest of it's going to be more tendinous, and you need to relax. I'm actually going to roll the leg out towards me a little bit here, and I'm going to add some resistance on the top of the foot. Good. And I can follow this tendon down. It's going to be quite obvious on the foot. And as we approach the insertion, it's going to cover two bones in the foot, here and here. So we can follow up the first metatarsal to the base, which is one of its attachments, and the bone just proximal to that is the medial cuneiform. So the tendon goes down and attaches more on the medial plantar aspect of those two bones. So again, it'll help pull up like so for that inversion, and then lift the foot up, which is the dorsiflexion. So dorsiflexion of the ankle and this inversion at the subtalar joints. And that's going to conclude our palpation of tibialis anterior. We're going to be palpating extensor digitorum longus, another one of the muscles from the anterior compartment of the leg. This muscle is going to be originating really high up here with tibialis anterior and fibularis longus. And I'm actually going to be using the other two muscles to try and get in the middle. So the first thing I'm going to do is ask my partner here to do dorsiflexion and inversion. Good. Giving me a little bit of an outline of where this tibialis anterior is. Great. And now I'm going to ask her to do plantar flexion, so push down and then out to the side a little bit. And that's going to fire off fibularis longus right here on that lateral fibula, and then relax. So I'm actually looking for the space in between tibialis anterior here and fibularis longus, which is in here. And now I'm going to ask for them to try and do a tricky motion. So a lot of people will struggle with this, but what you're going to ask them to try and do is to extend their toes without doing much dorsiflexion. Because extensor digitorum longus is extending the digits, you're going to see if you can feel any muscle activation in this anterior compartment while they do that. If you do not, what we're going to do is add a little bit of a help. So I'm going to add some dorsiflexion in the ankle. I'm going to hold it up a little bit. I'm going to hold on to the big toe, and again ask them to do that repetitive extension of their toes. Now you can see the tendon popping up there, and I can underneath in my fingers feel the muscle belly sticking up a little bit. We're We're going to add to it, add the next action of the muscle, and it's going to do dorsiflexion and some eversion. So if you ask them to do a little eversion and extension of those toes, you're going to start to feel a little bit more, and you can see that tendon popping up nice and high for us. So the origin is very proximal on the lateral tibial condyle, as well as deep on the interosseous membrane, this proximal part of the leg, and then on the anterior fibula. Some references will include the head of the fibula, some will not. It basically just means it skips the head and starts on this anterior shaft. So the belly is quite long up in this part of the leg here. And then similar to tibialis anterior, as we approached kind of more past that halfway point, it is going to turn tendinous. So I'm going to go back to resisting extension of the toes, and you can easily see this tendon sticking up right through this area. So you're going to follow that tendon down. It's held down by a retinaculum in this area. And once we get past this extensor retinaculum, you're going to see the tendons are starting to split apart into 4. So what I'm going to do is just change the position of the camera and on the foot, and I'm going to resist toe number 2, and I'm going to try to follow that out. So as I have extension of that second toe, I'm going to follow it all the way out towards that second digit. Great. Where it's going to attach to both the middle and distal phalanx of this toe via that dorsal digital expansion. Now we're going to repeat the same process for each of the toes. So that's completing for toe number 3. I'm going to do that on toe number 4. You're seeing a little bit more obvious tendon on this one as it goes into, again, that middle and distal, and finally one for the 5th, and you can easily see that, and I can just trace all along that one. Okay, so inserting into toes 2 through 5, the middle and distal phalanx via the dorsal digital expansion. Just going through the actions of this muscle, it's going to be extending toes 2 to 5 at all of the joints, so metatarsal, phalangeal, proximal, and distal phalangeal joint, so extending all the toes. It is going to be doing dorsiflexion of the ankle, and finally it's going to be doing some eversion of the subtalar joint. So if they're able to go through that full motion for you, sometimes you'll be able to follow the muscle all the way along the belly. But again, as I said earlier, the belly at the proximal end is going to be a little bit tricky because it's often covered, but you will get a better presentation on the dorsum of the foot into the toes. That's going to complete our palpation of this muscle. We're going to be palpating extensor hallucis longus. So hallucis referring to the big toe here, and obviously extensor meaning it does extension. It is the 3rd muscle of the anterior compartment. I'm actually going to be starting at its insertion and working my way up towards the origin. The insertion is just a lot easier for you to find, and because the origin is under muscle tissue, you're going to start with the more obvious part and then work our way into what's a little bit more challenging. The first thing I'm going to ask my partner to do here is I'm going to brace her foot and ask her to just try to lift that big toe up. So kind of like a big toe thumb up. If you're able to, that's great. If not, you might need to assist them a little bit. But if you can add some resistance to the distal phalanx, which is its insertion. So we're going to need to relax your toe just a little bit. It's inserting on the base of the distal phalanx of the big toe. Remember, there is only 2 in here, a proximal and distal. There is no intermediate. So I'm going to add some resistance. Here is that tendon, and I'm going to follow it across the dorsum of the foot. It's quite easy for me to follow. And then once I get up at the ankle, it's going to get close to tibialis anterior. Let's show that just for a second. If we do inversion, you'll definitely see more of tibialis anterior. If we bring the foot back to neutral and ask them to just stick up their big toe, and I add a little resistance to that, it's going to make this extensor hallucis longus tendon a little bit easier for me to follow up. So tibialis anterior here, extensor hallucis here, and extensor digitorum over there. So hallucis is going to go up, and right away it's going to go underneath the other two muscles of this anterior compartment, which makes this part more challenging to find the muscle. So I have a tip for you, and basically what you're going to do is you're going to ask them to extend their big toe, and then you're going to add a little bit of a up and down pressure while they're contracting it so that you can try to follow that muscle movement. So you're basically trying to lengthen the muscle while you palpate up. Extensor hallucis longus is originating on the middle anterior surface of the fibula as well as deep on the interosseous membrane. So you're going to be able to find the tendon up to around this area, and now you're going to be looking for a muscle belly. So typically it's easier if you pulse the muscle or do a little bit of a lengthen and relax and lengthen and relax, and that will help you try to identify where the origin is. If you think about it in the basics though, if the entire leg here was split up into thirds, the origin is in the more middle third of that anterior surface of fibula and interosseous membrane. Because of its orientation from a lateral origin to the most medial part of the foot as an insertion, this is going to be extending the interphalangeal and metatarsal phalangeal joint of digit 1, or the big toe. It is going to do dorsiflexion, and then it pulls that inside in a little bit, so it also is in slight inverter at the subtalar joint. And that is going to conclude our palpation of this muscle. We're going to be palpating fibularis longus, otherwise known as peroneus longus. So I'm going to be rolling the leg out to get more of a lateral view. And we're going to be identifying the head of the fibula as the uppermost attachment for it. So I'm going to start by finding the tibial tuberosity of the tibia. And I like to move straight lateral until I encounter the head of the fibula, which is a little bit more posterior than it is anterior. There are a few other ways to identify it, so look for other videos on how to find this head of the fibula. But once you've identified the head of the fibula, I'm going to ask my partner here to do the prime function of these fibularis muscles, which is eversion. So I'm going to provide some resistance to the outside of the leg. Great. And then relax and push out into me again. And you can easily see the taut tendon of fibularis longus going all the way up to approximately the halfway point in the leg. And then the tendinous part stops and we get into more muscle belly. So the muscle belly is originating off this head of the fibula and the proximal lateral shaft of the fibula right in this area here. And then around that halfway point is where it starts turning more tendinous. So again, we'll get that activation. Great. So I'm going to turn more to a strum as I cross fiber this tendon. You can see me bouncing up and down on it right in this area here. And we're going to go behind the lateral malleolus of the fibula. And this is where you're most likely going to lose visual of it. So I'm going to relax the foot a little bit here. So proximal to the lateral malleolus is a more prominent fibularis longus tendon, but as you go behind and below, if they push out into eversion, it actually becomes the brevis tendon, which is more obvious. The longest tendon is actually diving right here as it's going to go underneath the bone known as cuboid. I'm just going to bring the foot up a little bit. So it's going underneath cuboid. It's running across the plantar aspect really deep in the layering, and then it's going to be inserting over on the medial foot. So I'm going to take my other fingers and orient myself. I'm finding the base of the first metatarsal and the medial cuneiform. So where I am right here with my fingers is the insertion of tibialis anterior, but on more the lateral plantar, deep inside the layering of the foot, is the insertion of fibularis longus. So the same two bones, but more on the lateral plantar versus tibialis anterior on the medial plantar. So that means that these two muscles kind of work opposing each other, tib ant doing dorsiflexion inversion, and fibularis longus doing plantar eversion. You will not be able to find the tendon's exact insertion into the two bones, so just reference using the medial aspect and then kind of sinking in to the plantar aspect of the foot. So that is going to conclude our palpation of fibularis longus. We're going to be palpating fibularis brevis. So if you've just watched fibularis longus, fibularis brevis is in the same lateral compartment of the leg, and it is originating below where fibularis longus was. So fibularis longus on the proximal fibula, and now fibularis brevis starts where longus stopped originating. So what I'm going to do is I'm going to ask her to do that same action of eversion and plantar flexion, and I'm going to add some resistance into that. And where we feel the tendon of longus begin, which I'm able to strum back and forth across it, what you're going to do is you're going to go to more of a pincher grasp on either side of that tendon. So I'm going to get her to relax now. So I'm going to squeeze on either side of this longus's tendon and then ask for some resistance. Great. And if you're doing more of a pure eversion on the lateral compartment, you should easily be able to feel this fibularis brevis muscle. One analogy that I like to kind of bring up for this lateral compartment is kind of like a hot dog and a bun. So if we have a pressure on the longest tendon, consider this the hot dog, and then if you go on either side of it, brevis is the bun. So you'll be able to feel it on either side of that longest tendon for brevis's muscle belly. As we get closer to the bottom aspect, just above this malleolus, brevis is also going to turn to a tendon, and they are one stacked on top of the other. So consider the longest tendon is sitting directly on top of brevis tendon. So as you go by the malleolus, you won't see the brevis because it's underneath the longest tendon. So you will only really see one tendon group kind of right here until it goes underneath. Now, as we described just in the previous video, the longest tendon starts to dive underneath the cuboid, and the brevis tendon continues on the lateral aspect of the foot. So you'll be able to feel it just past the malleolus, or the inferior part of it, and I'm going to follow this tendon, add a little resistance, great, as I go right out into its bony insertion, which is the styloid process or tuberosity of the fifth metatarsal. So right in this area, I can palpate up and down, up and down, up and down. Here is the most proximal part of that fifth metatarsal. It is a sharp projection known as the styloid process. One more time, just push out into eversion for me. Great, so right in this area is our final insertion. Just like longus, this muscle is going to be responsible for a plantar flexion and a primary action of eversion of that subtalar joint. That's going to conclude our palpation of fibularis brevis. All right, we're going to be palpating the muscle gastrocnemius. So gastrocs has two heads and they're sitting on the posterior aspect of the calf. Now, personally, I like to put my knee up underneath the table because I am going to be sinking into the back of the person's popliteal fossa in their knee. So I'm going to lift up the leg and I put my knee underneath and just rest the foot in here. So as we are palpating for the origin, gastrocnemius is originating on the posterior femur. However, when you go looking for the posterior femoral condyles, you want to go in between the hamstring tendons. So very gently, I'm going to ask him just to bend his leg up, kind of right in here. Perfect. So this right here is semitendinosus, and on the lateral side is biceps femoris tendons. So I'm going to place one finger in here. We're going to go for the lateral head first. I'm going to soften up and bend in his knee, and then try to sink down in towards the back of his femur. And at this point, I don't want him to flex his knee. What I'm actually going to ask him to do is do a little plantar flexion, which means he's just going to push his toes up towards the ceiling and then relax back down at his ankle, and then do that again for me. Great. And I can feel the tendon of gastrocnemius on this lateral head originating on that posterior femoral condyle. I'm going to switch hands. I'm basically going to do the exact same procedure. I'm going to be going inside to semitendinosus this time. And a nice bent knee. I'm going to sink down towards the femur, and again I'm going to ask him just to push his toes up. Good, and relax. So I'm now feeling the tendon of the medial head of gastrocs on that posterior medial femoral condyle. As we said, there's two heads, and depending on the person and their genetics, you might see different sizes of both the medial and lateral heads or presentations. So what we're going to do is I'm going to get him to try to push with his midfoot up towards the ceiling while I give him some resistance. He's just going to hold that. So we can see right in here the lateral head of gastrocs, and there's a little bit of a drop off right there. So this is the distal kind of portion of it before it turns into tendon. So we have muscle belly, muscle belly, muscle belly, and then it starts to turn to the Achilles tendon. We'll give him a break. He's going to relax a little bit. We're going to go on to the medial side. He's going to do that again, push up towards the ceiling. Perfect. So again, I can grab this head, traditionally a little bit larger. And again, with him, you can see it's a little bit bigger, and then it's turning to a musculotendinous junction around here. So there's the end of his lateral head, and around here is the end of the medial head of gastrocs. Now that is pretty normal, but the length of gastrocs in comparison to the leg may vary from person to person. Like I said, often related to genetics. We're going to get him to push it a little bit. I'm not going to resist him as much this time. So you can see that Achilles tendon that's starting to stick up, and we're going to follow that Achilles tendon all the way down until it starts to make attachment on this calcaneus. He's going to relax for me. And you can, again, I'll move that calcaneal tendon back and forth, otherwise known as Achilles tendon, and it starts to insert right here on this portion of the calcaneal tuberosity. So the calcaneal tuberosity being basically almost the whole heel. However, the Achilles is going into a posterior, superior aspect of it, right in this area. So gastrocs, in this case, is going to be doing plantar flexion at the ankle, but it also assists in flexion of the knee joint. And that's going to conclude our palpation of the muscle gastrocnemius. We're going to be palpating the muscle known as plantaris. Plantaris is a muscle of the posterior aspect of the knee that often is associated with gastrocs. So similar to the gastrocnemius palpation, I'm going to be bending up the leg, putting my knee up underneath it just to try and soften the musculature up a little bit. Plantaris is similar to gastrocs in its origin and its functions. So when you go looking for the plantaris origin, first thing you're going to do is picture the lateral head of gastrocs. So again, as lateral gastrocs goes up onto the posterior femoral condyle, above that is going to be the muscle plantaris, which is originating now on the supercondylar ridge. So the lateral supercondylar ridge of the femur. So the lateral gastroc versus something more like plantaris. The plantaris muscle is the only muscle belly in the back of the knee. So if you gently push and start to sink into the popliteal fossa, I'm going to soften up his leg a little bit more and go back and forth inside the fossa. Please take caution about the tibial artery as well as nerve running in this area, or popliteal artery, pardon me. So that popliteal artery, you may feel a pulse, the tibial nerve running in the back, but I'm going to ask him now to plantar flex. So he's going to push his foot down, just like we did with gastrocs. And what you may feel is a small lift, pushing your fingers up and down. Please ignore gastrocs is firing. So I'm just going to point that out. This area here is going to be gastrocs, but if your fingers are lifting up and down from inside that popliteal fossa, there's a good chance that is plantaris. The muscle is running a little bit on oblique, but mainly between those femoral condyles. It runs inferior and slightly more medial. It's underneath the heads of gastrocs, and then it turns tendinous, and it has a really long tendon that basically goes down and then merges with the Achilles tendon and all the way to the calcaneal tuberosity, just like gastrocs. There is no real easy way to identify this portion of the muscle once it's finished its belly and turns to tendon. So again, oftentimes you just see a long stringy portion of tendon that blends into the Achilles all the way to the calcaneus. Similar to gastrocs, it is going to be a plantar flexor at the ankle and a flexor, very mild, at the knee. And that is going to conclude our palpation of the muscle plantaris. We're going to be palpating the muscle soleus. Soleus is in this posterior compartment of the leg underneath the two heads of gastrocs. So for that, I'm going to need to soften up gastrocnemius. So the way that I like to do that is to lift it up. I'm going to be placing my knee underneath, like I've done in the gastroc videos, and that kind of softens up the gastroc heads on top. So we're going to go through the origins of soleus. It has two distinct kind of origins. One is on the fibula. So the first thing I'm going to do is try to find the head of the fibula. I'm going to ask him to just lift his leg up and put a little pressure. Perfect. So this is the biceps femoris tendon, and that's going into the upper or apex of this fibula, and then just below that is more the full head of it. So you're going to watch me push onto the posterior aspect, and he's going to relax. And now as he does plantar flexion, he's going to push his toes towards the ceiling and then go back down. Watch what happens to my fingers on that fibula. So as soon as he does that and relax, and now push up again. Good. I'm easily feeling soleus push my fingers off that proximal fibula. So we're going to repeat that as we travel down the proximal shaft of the fibula. And this is soleus underneath pushing me over, which is really good. You can easily see his gastroc head above, but gastroc doesn't actually attach to the fibula or the tibia for that matter. So this is soleus. The second attachment to soleus is known as the soleal line of the tibia. So one way to kind of identify where that is because there is no soleus in this quadrant of the tibia. As you sink in, it's quite squishy. But then as you work your way lateral, it's going to get into much denser tissue. And the soleal line is running from the head of the fibula on an inferior medial oblique angle. And that's how you would basically trace the soleal line. But then I'm going to hook through gastroc into the denser muscle tissue below it, trying to fire off this muscle named soleus. So I'm going to hook, and he's going to plantar flex and push his toes up towards the ceiling. Good. And I'm getting lifted up and back down. Let's do that again. So again, because we've kind of softened up gastrocs as we're doing this, you're feeling more of a pull from the deeper musculature, the next layer being soleus. So underneath on both sides, I'm going to get him to bend a little bit further this time. And then he's going to plantar flex on his own. So you can see right in here, and just hold that contraction for me. This is a softer gastroc, but underneath is a very ropey, dense soleus. So I'm going to give him a little resistance just to make that fire even more. This is a postural muscle. We use it to help us stand, so we often have a lot of tension built into soleus. So we can follow underneath that Achilles tendon, soleus, making its way down. And approximately in this area, you can relax, I'm noticing a change of less kind of squishy muscle tissue and more just dense tendon. So now this is complete Achilles tendon, and just like gastrocs, we're going to follow that right into the calcaneal tuberosity right here on the calcaneus. Soleus is only crossing this ankle complex, so the only action that it does is going to be plantar flexion at the ankle. That's going to conclude our palpation of the muscle soleus. We're going to be palpating the muscle known as tibialis posterior, which is in the deep posterior compartment of the leg. So we're going to be palpating through gastrocs and soleus, and for that reason, I'm going to be trying to shorten up that muscle a little bit. So I'm going to be placing my knee up on the table here. We are going to first try to identify where the head of the fibula and that proximal shaft and where soleus is in the soleal line. The reason for that is if soleus is approximately attaching here, then tibialis posterior is going to be deep to soleus, just a little bit more distal. So I'm going to be sinking in, and I'm trying to do this nice and gently. However, you're going to feel a lot of thick kind of tissue. It gets very dense, I should say, versus if you're more on the medial aspect, you're going to be able to sink a lot easier. But when you're on the lateral aspect, you're going to have more layers. So the first muscle is gastrocs, then soleus, and then underneath that, originating on the proximal posterior surface of the tibia, interosseous membrane, and fibula, is going to be the muscle tibialis posterior. Now, because gastrocs and soleus and tib post all do plantar flexion, we don't want to use plantar flexion to help us find this muscle. So instead, I'm going to be trying to isolate it using just inversion. Now, this can be a little bit tricky, but again, I'm going to show my partner here the action I'm going to ask her to do. And she's going to go ahead and do it on her own. Great. But what you don't want is any plantar flexion, because that's going to kind of mask it with soleus. So again, let's try just like that while I sink in. Now, if you watch my fingertips, I'm actually getting lifted up and down and up and down and up and down. So that's a good job, just trying to do inversion. And I'm going to follow this muscle down the posterior leg. So it does have quite a long muscle belly that travels inferiorly. Underneath, as I said, gastroc and soleus. With the other two deep posterior muscles, it's going to go behind the medial malleolus. So I'm going to roll the leg a little bit. So we're seeing the medial malleolus here. I'm going to ask for some inversion into my foot, and oftentimes there's a tendon that sticks up right in this area here. And then it's going to start to insert. Now, some people kind of have a joking way of remembering it, that it inserts on every bone of the foot other than talus. However, I'm actually going to try to palpate each bone individually. So I'm just going to change the position of the foot so we can kind of look down on it. So the first bony landmark that I'm going to access is going to be right here on what is known as the navicular, specifically the navicular tuberosity, which should be a pretty easy one for you to find. If they do some inversion again, just start to pull your foot in for me. I'm going to resist. Great. The tendon goes right into the navicular tuberosity, and from here it's going to splay out across the bottom of the foot. Now, to make sure that you're not tickling your person, I'm going to use more of a firm palpation with this. So I'm going to move back onto the calcaneus, like so, one attachment being of the calcaneus. From the navicular, I'm going to move lateral across the plantar aspect till we get towards cuboid. In this area, it's going to attach to all three cuneiforms, so medial, intermediate, and lateral cuneiform. Another way to kind of look at that is you should be in line with toes 1, 2, and 3 for those three cuneiforms. And then lastly, I'm going to use my fingers on the dorsum of my thumb on the plantar aspect. I'm feeling for the base of metatarsal 2, the base of metatarsal 3, and the base of metatarsal 4. So all of that being the insertion of tibialis posterior, which is going to be really tricky to feel each one of those bones through this plantar aspect, but do your best to try and sink in and showcase all of those insertions. Because of that, this is definitely going to be a very strong inverter as it pulls all of these kind of bones together, bringing the foot into inversion. And then because it goes behind the malleolus, it's also going to be doing plantar flexion. So inversion at our subtalar joint and plantar flexion of the foot at the ankle complex. And that's going to conclude our palpation of tibialis posterior. We're going to be palpating the muscle known as flexor digitorum longus. Flexor digitorum longus is one of the muscles in the deep posterior compartment. It is originating on the tibia, and we're going to be kind of orienting that's the middle, proximal middle aspect of it. So we're going to look below the soleal line of the tibia and kind of sinking in and through. Now again, as you've seen before, I like to put my knee up on the table just to soften up gastrocs and soleus a little bit. And this flexor digitorum longus, to activate the muscle and try to isolate it versus soleus and gastrocs, we are going to be relying on your person to be able to kind of curl their toes. So giving her that kind of tactile cue, you might put your finger or something along the toes and ask them to kind of curl in on that if they need it. If not, they might be able to do that on their own. Just curl your toes for me. Great. So I'm going to be sinking down through gastrocs and soleus. Take your time. And then asking them to curl their toes and relax. and then move over again and try that again. Curl your toes. So you might not feel a strong contraction, especially that you're going through a couple layers. Another thought is that because it's on the ulna, if you can try to pull gastrocs and soleus out of the way and get more onto that distal medial aspect of it, and then again ask them to curl their toes, you'll start to feel a little bit more of a muscle belly. So a lot of times people have a lot of tenderness along this distal medial aspect, and that is one of the concerns from flexor digitorum longus. So again, curling your toes for me, and I can feel a contraction in here. If you need to, add a little bit of resistance on those toes, and then you can lengthen and relax and do that again and curl and start to feel more of this muscle belly's action. You want to try to avoid this plantar flexion as much as you can while you're doing your palpation. So you're following flexor digitorum down. It goes behind the malleolus with tibialis posterior. So again, I'm going to ask you to kind of curl and hold that position. So we have tib post here, and then in behind that you have flexor digitorum longus, and it's going to make its way into the foot before it splays out into its four tendons. I'm going to again add a little resistance. A window of opportunity that you might be looking for here is we're looking for navicular's tuberosity here, and I'm looking for kind of the calcaneus here, so it's going in between those two bony landmarks into the plantar aspect of the foot. All right, let's just change our view a little bit here. So at this point, the tendon is going to be splaying out into four independent tendons. So like I've seen in other videos with the extensors and the flexors, I'm going to ask for resistance on one toe at a time. So I'm going to ask her to curl here, and then I'm going to sink in and try to find this digitorum tendon. It is in the second layer of the foot, so it might be masked by your flexor digitorum brevis, but sometimes the tendons kind of stick up, as this one's going all the way to the distal phalanx of this digit. I'm going to do the exact same thing here again. So you're going to get you to curl, sinking in to the plantar aspect of the foot and following it all the way out to the distal phalanx, and you will repeat this process for toes 2 through 5, and finally with the baby toe here. So another thing to think about is that when this tendon enters into the foot, it's going to create a diagonal across the plantar aspect of the foot, making kind of this tendon the shortest in the foot and the tendon for the second the longest. So you can almost kind of see my trace mark across the bottom of the foot like so. So there's going to be a tendon, a tendon, a tendon, and a tendon. Just to repeat the actions, it's going to be flexing toes 2 to 5 at all of their joints, both IPs and MTP. Because it's going behind the medial malleolus, it's going to do plantar flexion, and it's going to pull the foot in an action known as inversion. And that's going to conclude our palpation of flexor digitorum longus. All right, we're going to be palpating flexor hallucis longus. It's one of the 3 muscles of the deep posterior compartment. I'm going to be, again, putting my knee up on the table here and trying to move some of the musculature over in a slacking position. We're going to be looking on the middle posterior surface of the fibula as our origin. So thinking about soleus, which is taking up the head and the proximal shaft, and then flexor hallucis longus is starting a little bit more in the middle to distal part of this kind of bone area here. I'm going to push over soleus, try to get on the back of the fibula, and then I'm going to give her a tactile cue, which is to kind of tap on this big toe and see if they can flex that toe. Otherwise, you can add a little bit of resistance and get them to relax, and again get them to curl and repeat that process a few times. Now I can quite easily feel this with her. However, you won't be able to feel this on every person, especially if they have difficulty activating this big toe curling action. So the muscle belly is in this kind of posterior quadrant here on the lateral aspect, and then it's going to make its way down underneath gastrocs and soleus, which is where it has a bit of an interesting pathway into the foot. It's behind this Achilles tendon. It's making its way back, and then once it gets into the tarsal bones, it actually goes behind the talus. So there's two bumps on the back of the talus on the posterior tubercles. So it goes behind the talus, and then it's going to go underneath something called the sustentaculum tali. So I'm just going to show that for you. Here is the medial malleolus. I'm going to drop off the medial malleolus heading in towards the foot, and there's almost a shelf. So once you drop off this shelf, that's the last part of bone. You get into more the muscle tissue on the plantar aspect. This is the sustentaculum tali here. So the tendon of flexor hallucis longus goes behind the talus, and then it goes underneath the sustentaculum tali. So if you ask them to curl their toe, you may feel a little bit of a tendon moving back and forth in this area. This is quite deep, and then that tendon is going to travel down the plantar aspect of the foot all the way out to the distal phalanx and inserting in this area here. So fairly complex in its actions because it's crossing behind the malleolus. It is going to be doing some plantar flexion and some inversion, and then obviously in its name it's flexing the hallux or the big toe at this metatarsal phalangeal joint and the interphalangeal joint. And that is going to conclude our palpation of flexor hallucis longus. We're going to be palpating the muscle abductor hallucis. So abductor is in the first layer of the foot. So what we're going to be doing is palpating a muscle that runs down the medial aspect of the foot. We're going to start off on its origins in this area here known as the calcaneus and the calcaneal tuberosity right in here. So I'm going to be palpating more on the medial side of it. So this part of the foot here is called the medial process of the calcaneal tuberosity, and this muscle is originating kind of more on this side in here. So it has a bony attachment in that calcaneus, the medial process, but it also has a secondary soft tissue known as the plantar fascia. The muscle in its name is abduction, so abductor hallucis. I'm going to be showing my partner here the action, which is going to be an abduction and flexion motion like so. So I'm going to have him try to do that on his own. And what you're noticing is a lot of individuals have quite a difficult time, especially with this abduction. If you even take a look at the way his big toe is oriented, it is slightly pointing out, which means getting it to go into a neutral position, let alone even further into an adducted position, AB, it's going to be even really, really tricky. So instead, I'm going to be showing the action as we go through. So you're going to try to have your person push like this while you work your way along the medial part of this arch. Now, if you can, you might ask the person to try to push their toe down. So I'm going to ask him to do that, which he's able to. So he's using his abductor hallucis more as a flexor than as an abductor, which is its secondary action. So again, working ourselves along the arch like so. And then he's going to relax for me. Good. And then again, you can start to push down a little bit. Excellent. And then I'm going to follow it to its insertion. So go ahead and relax. This muscle is crossing the metatarsal phalangeal joint and inserting here on the base of this proximal phalanx. So this is our insertion point right in here. I've already talked about those actions. Let's mention them one more time. This is a abductor and flexor of the first digit or big toe at the metatarsal phalangeal joint. And that's going to conclude our palpation of this muscle. We're going to be palpating the muscle known as flexor digitorum brevis. So flexor digitorum brevis is a muscle of the first layer of the foot, where longus is one of the deep compartment of the posterior leg. So this one, brevis being shorter, it is going to be originating on our calcaneus. The calcaneus, specifically as part of the bone here, is known as the calcaneal tuberosity. And then on that plantar aspect of it, it has what is known as the medial process and then a smaller lateral process. So flexor digitorum brevis is originating basically in the center of this heel bone, the calcaneus, on that medial process, as well as to the superficial plantar fascia through this area. Now what I'm going to do is I'm going to be placing my fingers onto the middle phalanx, so not the distal tip, but actually the middle of 2 to 5. So I'm going to curl my fingers around his toes like so, and then ask him to curl his toes against my fingers. That add a little resistance, and then relax, and then do that again and curl for me. And you can easily see some muscular activity in that first layer of the foot here. So I'm grabbing, trading a little bit of a pincher grasp, and following our way down the majority of the sole of his foot. He's going to relax. And now I'm going to switch over to an individual toe at a time. So I'm going to get him to try and curl this one. Obviously, they're going to most likely activate all of them, which is fine, but I'm only adding resistance to the toe that I'm trying to palpate. As I palpate the tendon, which goes out to both sides, so the medial and lateral sides of that middle phalanx. And you're basically just going to repeat this for toes 3, 4, and 5. So it is inserting again to the middle phalanx on both sides of it to toes 2 through 5. And because of that, it's activating on those toes 2 to 5 while it flexes toes 2 to 5 at this first joint here being the metatarsal phalangeal and then this proximal interphalangeal joint. And that's going to conclude our palpation of flexor digitorum brevis. We're going to be palpating the muscle known as abductor digiti minimi pedis. So abductor digiti minimi pedis is going to be an abductor of this little toe right here. It is in the first layer of the foot, and it is originating on the calcaneus. So again, this whole area is known as the calcaneal tuberosity. We are on the plantar aspect, and on this side of this plantar aspect, we have a lateral process. So over here was the medial process, and on this side is the lateral process. So this muscle is originating kind of right in this area, or sometimes slightly over on the side, and its action is going to be abducting and flexing your 5th digit. So I am showing him the action right now, and I am going to put a little bit of pressure on the outside of his pinky toe and see if he's able to push out. Getting a little bit of an action. Good. That's a good attempt. Let's watch that one more time. He's going to push into it just like that. Perfect. So as he adds some pressure, again, he is doing a little bit more of that flexion than the abduction, which is okay. So again, a lot of people will use this as a flexor more than a pure abductor, but you might have people that are easily able to just stick their toe out to the side like this. Again, I'm giving him a little digital pressure, and I'm going to follow from this bone and soft tissue origin down past the whole 5th metacarpal, and then it's going to be inserting here on the base of the proximal phalanx on the lateral plantar aspect of it, of that 5th digit. So again, lastly, this muscle is responsible for doing a abduction and flexion of the 5th digit at the metatarsal phalangeal joint. We're going to be palpating a muscle on the second layer of the foot known as the lumbricals pedis. Now, this is a bit of a tricky muscle. Technically, there's 4 bellies, one for each one of the toes, minus the big toe. And it is in that, like I said, that second layer. So we're going to be sinking through a bit of tissue here to try and activate it, and it also is a tricky action. But first, we're going to talk about its origin. I'm just going to roll his foot a little bit to the side. So if you've watched quadratus plantae or a previous video on flexor digitorum longus, we have learned its pathway of this tendon, flexor digitorum longus. It's coming out from behind the medial malleolus, enters into the foot, a little proximal to the navicular bone, and then it travels across, heading towards the 5th metatarsal. Off of it, there's a tendon for each one of the toes, minus the big toe, and the lumbricals pedis is actually originating on that tendon. So you have to have somewhat of an idea of where the flexor digitorum longus tendons are, and as I get closer and closer to the 5th, it actually shortens. So because it's on a diagonal, this one is the shortest versus this one is more the longest of those individual toe tendons. So what you're going to do is we're going to add a little resistance to the distal phalanx. He's going to curl his toe against my resistance. Perfect, just like that. I'm going to feel for this tendon, and then I'm going to drop medially. So I almost want to be in between the first and second metatarsal in this area, and here comes the tricky action. So what you're going to ask your person to do is to flex at the MTP, but hold the toe in extension. So I'm going to show them the action first. So it's going to look something like this. And I'm also going to demonstrate it with my hand for you viewers, just so you can kind of see. So the same hand muscle in lumbricals majus creates an action that looks something like this. And that's going to be the similar action that it's trying to do inside the toes. So it's flexing the metatarsal phalangeal joint while it holds the IP joints into extension because of his attachment to the dorsal digital expansion. So we can ask our person and see if he's able to do that action on his own. And again, we might end up with kind of a funky action of the toes moving around a little bit. He actually is getting a little bit of that action. So I'm going to show you an additional way to try and help them fire it off. So what we're going to do is we're going to take his foot and we're going to try to put it on a flat surface. So we're going to bend at the knee all the way up. So the toes are on a flat surface. I'm going to have my hand here as an example as well. And they're going to try to push their finger pads or toe pads into the surface without curling them up. So this is keeping the toes in extension while flexing across this metatarsal phalangeal joint. So you might have them do that and practice once or twice. I know he's able to do that action. It just might be easier to do it against some resistance than it is up in the air. So again, let's try that one more time. Push those toes down. Good. And now we're going to bring his leg back out. Okay. So in between metatarsal 1 and 2, I'm going to ask him to try and do that. Push down with his toe like so. Good. And hold that right there as I'm palpating the belly for this first lumbrical of the foot. And it's going to be inserting into the base of the proximal phalanx and then wrapping around onto the dorsal digital expansion of that second toe. Same idea. We're going to go in between metatarsal 2 and 3 and see if you can push down with that. Great, just like that. And I'm going to follow that to the same insertion for that third toe. And we're going to repeat the same process for the next 2 toes. So in between the metatarsal, and then again for our last pinky toe in between 4 and 5 here. And I'm trying to sink in between while they're doing that generic kind of push down motion, and we follow it to the proximal phalanx and the dorsal digital expansion. So one more time, just repeat the actions. It is going to be flexing the metatarsal phalangeal joint, as well as it's extending both the proximal and distal interphalangeal joints for toes 2 through 5. And that's going to conclude our palpation of the lumbricals pedis. We're going to be palpating the muscle quadratus plantae. Quadratus plantae is in the second layer of the foot. It is going to be an assister of flexor digitorum longus. So much like flexor digitorum brevis, which was inserting in the first layer off this medial process of the calcaneus, quadratus plantae is just a little bit deeper than that. And instead of just the medial process, it originates on both the medial and lateral process of the calcaneus on that plantar aspect. So because we are trying to slightly differentiate from flexor digitorum brevis, previously I was resisting on the middle phalanx, and this time I'm going to be resisting on the distal phalanx. So I'm going to ask him to try and curl his toes just like that. Good. And then hold that for a second and then relax. So you have this muscle that's very similar to flexor digitorum brevis. However, it's just a layer deeper, and its insertion is actually on the tendon of longus. So I'm just going to bring his foot slightly to the side here. We are trying to follow flexor digitorum longus into the foot. It's coming in behind the malleolus of the tibia, and it's going to enter into the foot just a little bit proximal to this navicular tuberosity. I'm going to ask him to curl his toes, good, and relax. And it's going to be crossing on the plantar aspect in the second layer, heading in the direction of the 5th metatarsal here. So if we had an approximate like so, this is the tendon of flexor digitorum longus, then our quadratus plantae is originating off that calcaneus, going along and then inserting into that tendon. So let me just try to show that. This was the tendon, the muscles going in and inserting into it. So as your ankle is kind of stationary and you wanted to curl your toes, this muscle could pull back on that tendon, directing its pull towards the calcaneus, giving you a little bit extra strength and a different line of pull, versus the longest tendon is going to end up having a little bit more of an inversion plantar flexion with it. This one's going to also be similar to flexor digitorum brevis and pull the toes almost straight back. Again, not an easy differentiation between flexor digitorum brevis and quadratus plantae, other than I was trying to use more of a pincher grasp for the first layer, and I am trying to sink down to the second layer while again resisting on the distal phalanxes of digits 2 to 5. That's going to conclude our palpation of quadratus plantae. We're going to be palpating the muscle known as flexor hallucis brevis. This muscle is in the 3rd layer of the foot, and again it's going to be responsible in its name for flexing the big toe, otherwise known as the hallux. So in some instances we're going to do a little bit of an extension across that. You will see some muscle tissue and tendon starting to stick up, so there is a little bit of an easier marker to follow along for this muscle, but our origin is going to be on the cuboid as well as the 3rd cuneiform. So what I'm going to be doing is just going off to the side here. This is an easy landmark to find, which is the styloid or tuberosity of the base of the 5th. And when I roll off of that, this is cuboid, so it's kind of helping me as a marker. So I'm going into pretty much the center of the foot, this being cuboid. I'm going to landmark on the other side now. Here is our navicular, making this the 1st cuneiform, and again in line with the 2nd toe, 2nd or intermediate cuneiform, and then the 3rd cuneiform. So right in here between cuboid and the 3rd cuneiform is going to be the origin of this muscle known as flexor hallucis brevis. Again, I'm going to add a little bit of extension across his toe. My fingers are starting to get lifted up a little bit right in there, and I'm going to now ask him to push, not necessarily with the distal tip, but more this proximal part of his toe. He's going to push his big toe down like that. Good. Let's try that one more time. And hold with your pressure right in there. Good. And I'm going to follow using a cross fiber because we are sinking through some of the other layers. And we're going to work our way towards its insertion. You can go ahead and relax. And again, I'm just going to stretch that out a little bit. So what's interesting about this muscle is it is going to have 2 insertion points where the muscle has almost 2 small bellies, and they're going to be splitting, one going to the medial aspect and one going to the lateral aspect of the base of that proximal phalanx. So you basically have kind of a 2-headed muscle like so. So you have equal pull on that great toe as it's inserting. Sometimes there will be 2 small sesamoid bones in this area too, so you might feel a little bit of a denseness inside that surface, but again our insertion is on both sides of the proximal phalanx of the 1st digit. For that reason, it really is only responsible for flexing the 1st digit at the metatarsal phalangeal joint, and that is going to conclude our palpation of this muscle. We're going to be palpating the muscle known as flexor digiti minimi pedis. which is going to be a flexor of our fifth digit here, as it's going to be pulling it into a flex position. We are going to be landmarking another tendon of a muscle crossing like so on the plantar aspect of the foot. This muscle is in the third layer. So what I'm going to be doing is trying to find its origin, and to do so, I'm going to be finding the outside lateral side of this fifth metatarsal, and as I drop off from that styloid or base of it, this is our cuboid, and the muscle that's running underneath cuboid is known as fibularis longus. So fibularis longus tendon is running across the bottom of the foot towards the direction of the medial cuneiform and base of the first metatarsal. So this is going to be one of its origins, as the muscle is basically running from this tendon as well as deep on the plantar aspect of this fifth metatarsal. So here's our two origins, and it is going to run down the plantar aspect of the foot and insert into the proximal phalanx. So I'm going to actively see if he can do that by his own. He's just going to flex his pinky toe, good, and relax. And let's try that again one more time. So he's able to do that on his own. So this will make it nice and easy. I'm going to put a little pressure towards that proximal phalanx just past the MTP joint. Go ahead and push down into me. Great. And I'm going to be using a pincher grasp and trying to follow our muscle belly like so, and even a little bit of a cross fiber strum until it crosses this metatarsal phalangeal joint and inserts here on the plantar aspect of that proximal phalanx. So again, quite easy. The tendon of fibularis longus and the base of the fifth metatarsal into the base of the proximal phalanx of the fifth digit, creating flexion of that fifth digit at the metatarsal phalangeal joint. And that's going to conclude our palpation. We're going to be palpating a muscle known as adductor hallucis, adductor hallucis. This is in the third layer of the foot, and in its name, as it's kind of saying, it's going to be an adductor of the big toe as well as a secondary. It's going to be pulling it towards the plantar aspect, which means it's going to be doing some flexion. We're going to be looking for its origin, similar to the hand version of this in pollicis. Hallucis also has two bellies, one of which is running a little bit more like this on an oblique, and the other transversely. So those are the names of its heads, the oblique head and the transverse head. So for this oblique head, what I'm going to be doing is trying to identify the tendon of fibularis longus. So again, I'm going to drop off the styloid process of the fifth onto cuboid. And so underneath cuboid is the tendon of fibularis longus crossing over the foot towards the medial cuneiform and the base of the first. So think like my finger is the distal tendon of fibularis longus. So a part of this origin is on this tendon of the oblique head as it runs like so. And then deep, just distal to that, we're actually looking for the base of, in this case, fourth, third, and second metatarsals. And what you're not really seeing is I'm also palpating on the dorsum of the foot. So I have interosseous space here, and when the interosseous space kind of goes away and I feel the bases, that's where I know where the base of 2, 3, and 4. So I'm basically palpating in a similar location but on the plantar aspect. So the oblique head's origin, tendon of fibularis longus, and the bases of the second through fourth metatarsals. That tendon, we're now going to try and see if we can fire off that muscle. So he's going to try and do a little bit of a squeeze. So again, I'm going to show him. He's going to try and squeeze my thumb and curl in a little bit. Good. And I'm going to add a little resistance out against him. Go ahead and just hold, just like that. Perfect. So I can cross fiber our muscle as I'm working my way towards the proximal phalanx of his big toe, just like so. And now relax. Good. And then again, gentle squeeze. Perfect. And relax. So that is the oblique head. Now the transverse head. This is going to be kind of an interesting origin, but it's actually originating from ligaments in between the metatarsals. So the intermetatarsal ligament along these heads. So I'm basically lifting up and down in between each one of these metatarsals. You're going to want to go in between the spaces. So there's a couple different reference names for this, but for palpation's sake, you're trying to find the head of the metatarsal and then strum ligamentous tissue in between them, kind of holding them all together. So that's going to be the origin, and it also inserts into the base of the proximal phalanx. So again, I'm going to give him the same cue. I want him to try and push his big toe over like so as I resist against it and relax. Okay, and just a gentle resistance. Perfect, just like that. And I'm going to strum across the transverse head of this adductor hallucis. Okay, so again, oblique head, transverse head, creating a adduction and flexion of the big toe at the metatarsal phalangeal joint. We're going to be palpating in the fourth layer of the foot, and our muscle is the plantar interossei. So for plantar interossei, they are adductors of the toes. So we're just going to take a minute just to make sure and orient ourselves with which toes do what movements. In the foot, the second digit is the center. So everything else moves away from that in abduction. So everything else would splay away from the second. And then everything would then obviously adduct towards the second. But for that reason, the big toe has its own, which we've previously palpated in a different video, known as adductor hallucis. The second toe does not have an adductor. It has two abductors. So we'll come back to that in a different video, which leaves us with three toes that are capable of adducting towards the center. So we're going to have three muscle bellies and three different insertions. However, all the origins to the insertions are very similar. What I'm going to try to do is feel the shafts of the metatarsals for the third, fourth, and fifth. So I'm going to be going in between metatarsal 2 and 3 and somewhat hooking my finger all the way down as deep as I can. This is not an easy palp. Like we said, this is in the fourth layer. And then we're going to ask our body here to do his best, basically to pinch. So this is what it's going to look like. He's doing his best right now to try and perform that action. It's not an easy one, but he's trying to pinch between his second and his third toe. Good. And then again, pinch. Awesome. And again, just try to pinch. Good. And I'm following it to the proximal phalanx of this third digit and its dorsal digital expansion. We're going to repeat this exact same process. So I'm going to go in between metatarsal number 3 and 4. So it's on the shaft of this fourth metatarsal. Good. And we're just activating that muscle slowly back and forth as we work our way towards the proximal phalanx. And then we'll repeat it on the last one. So I'm on the shaft of the fifth as I'm working my way towards. So again, that minor motion of him trying to adduct this little toe, and it inserts again into that proximal phalanx and the dorsal digital expansion. So the main function, as I kind of described, is adduction of toes, in this case 3 to 5. But because of the dorsal digital expansion, it also helps with flexion at the metatarsal phalangeal joint while extending the interphalangeal joint. So those would be kind of more secondary, as it basically squeezes your toes in. But a lot of people are able to squeeze and almost bring their toes into a point, which is therefore helping with that flexion and adduction of those toes. So that's going to conclude our palpation of the plantar interossei. We're going to be palpating the dorsal interossei of the foot. So dorsal interossei pedis. We're going to again just orient ourselves with actions of the toes. The dorsal interossei is more of an abductor. So we can abduct our big toe using adductor hallucis. I'm going to cover that one up. And we can abduct our pinky toe with adductor digiti minimi, which is going to leave us with 3 toes. Now, if you've already watched plantar interossei, we described which toes can adduct, but I'll just repeat myself here. This second digit, because it's the center of the foot, it's going to be able to abduct in two separate directions. So that means there's going to be an abductor that pulls the toe medially, as well as there's an abductor that pulls this toe laterally. So that's two. We're going to have one that pulls the third toe towards the fourth. That's three. And finally, we have a fourth belly that's going to pull this fourth toe over towards your fifth. So there's 4 dorsal interossei muscles, and it's pretty easy to memorize their origins because it is what we'd call adjacent metatarsals 1 through 5. But basically what you can assume is for this first one, it's originating off the shaft of this first as well as second. So you can make it really complicated and say the lateral surface of the first and the medial surface of the second, but I'm just going to kind of leave that detail out. You can kind of figure that out on your own. So adjacent metatarsals 1 and 2. And then what I'm going to do is I'm going to place my finger in between his big toe and his second digit and ask him to kind of squeeze these two together. So in this type of a motion, go ahead. Okay, so as he's doing that, I'm sinking my fingers in between those two bellies and go ahead and squeeze. Good. And you'll feel your fingers slightly getting raised up in this area. Now, not everybody can do this very easily. So again, give a little bit of patience, ask them to squeeze, and sometimes you might ask them just to push their toes into the table and squeeze. So we're following from 2 origins, and then we're finding the insertion on the base of the proximal phalanx of the second digit and then into the dorsal digital expansion. So you're basically going to repeat the same process for all of the other ones. So this time I'm going in between the second and third metatarsals. There's a little bit less space for me. I'm going to go in between toes 2 and 3. He's going to try to squeeze these 2 toes together as I am abducting this second toe. So again, go ahead and squeeze for me. Good. And again, go ahead and squeeze for me. Awesome. So you can feel just a very small amount of raise as this inserts onto this lateral side of this base of the proximal phalanx of the second digit. And again, it's dorsal digital expansion, helping pull it into abduction here. Number 3, in between the third and fourth metatarsals. Again, he's going to squeeze my finger here, trying to move these 2 together. Good. As I'm going to follow that into the lateral side of this third. And one last time, in between the fourth and the fifth metatarsal and inserting into its proximal phalanx. So again, just a repeat of its actions. It abducts the second toe in 2 different directions, this way as well as this way. And then it's going to abduct the third toe and the fourth toe laterally. So that's their main function, abduction at this metatarsal phalangeal joint, but because of the dorsal digital expansion, it also assists a little bit in flexion, so that pushing kind of down motion while holding both the interphalangeal joints straight. And that's going to conclude our palpation of dorsal interossei pedicle. We're going to be palpating the muscle known as extensor digitorum brevis. Extensor digitorum brevis is one of the 2 muscles on the dorsum of the foot. So what we're going to start off by looking for is its origin, which is the dorsal surface of the calcaneus. A landmark that I like to use for that is to first identify the lateral malleolus of the fibula. And you're going to roll anterior off of it, and you often find this hollow. It's almost like a sink-in location. So kind of medial to my hand here is the talus, but this is still calcaneus, and then just distal of that is going to be the cuboid. So right in this hollow right in here is the origin. This is calcaneus, the dorsal surface of it. So I'm going to place my finger, and then what I'm going to do is hold down toes 1 and 5, and I'm going to ask him to try and lift 2, 3, and 4 up off the table, like so. Good. So if you're looking just past my finger, he's going to relax his foot back down. So look right where I'm pushing on right now, right in this area here. Go ahead and start to lift up your toes. Good. So this is extensor digitorum brevis's belly. So it's nice and easy to see. In some instances, it might take on a little bit of a blue hue to it. So I like to call it the blue marshmallow. He's gonna lift his foot up again. Great, so right in that area, you can see his extensor digitorum brevis muscle. And what's unique about it is that it only attaches to 3 of the toes. So often it's 2 to 5, 2 to 5, 2 to 5, but in this muscle's instance, it's actually only 2 to 4. So that's why I've asked him to lift his toes up while I held down 1 and 5. So we basically have a muscle belly and then a tendon, and the tendon's going to be underneath this very obvious looking digitorum, and it's going to blend into the longus tendon near the metatarsal phalangeal joint. Now, if we look really, really carefully on our model, he's going to relax his toes all the way. I want a very small amount of resistance, and we're going to kind of look right in this area here. So again, he's going to start to lift up his toes right there. There is a secondary tendon, not this more obvious one. Relax, and now start to lift up again, and up, up, up. Good, and I'm going to kind of pull down on it, and then one more time. So I can use my nail, and I'm actually cross-fibering his brevis tendon kind of right in this area as it works its way back towards the muscle belly. So think there's one of those tendons for these 3 toes. So again, we're going to put a little bit of pressure on this one, and right in this area here, it's going underneath the digitorum longus back towards belly, and we'll do this one more time. And this one, again, you can quite easily see that. Relax your toe down and just start to pick up this toe right there. There's a tendon, it's quite strummable, and then it's going to go kind of get buried as it goes underneath longus back to its muscle belly origin. The insertion's a little bit tricky, but again, it's blending into the extensor digitorum longus coming in from the lateral side. So that's often what it states, is that it inserts into the lateral side of this longus tendon, and longus is going to be going into the middle and distal phalanx, in this case 2 to 4, via the dorsal digital expansion. So depending on your text reference, because that this is attaching to the longus tendon, I'm just going to include all of the toe joints, even though there is a little controversy on how much action does it actually have on the distal phalanx. So again, he's going to lift up on those toes. Great, just like that. So it's extending the metatarsal phalangeal, the proximal, and the distal phalangeal joint of toes 2 through 4. And that's going to conclude our palpation of extensor digitorum brevis. We're going to be palpating the muscle known as extensor hallucis brevis. So if you've already watched our previous video on extensor digitorum brevis, we're going to be looking for the same origin. I'm going to be finding the lateral malleolus of the fibula, just rolling off that. There's a little bit of a hollow sink-in location here, and this is the dorsal surface of the calcaneus with the cuboid just distal to that. So this right here is the belly for extensor digitorum brevis, but if we had just a little bit more medial in that similar location, this is going to be the origin for extensor hallucis brevis. So what I'm going to ask my partner to do right now, just while I'm keeping my finger in this area, is to just lift his big toe up. Good, and back down. Now he's able to do this quite nicely, and just isolating the big toe. You're not wanting all the other toes to stick up, so you might need to hold the toes down while they just use the big toe. So we're gonna take a look, just kind of right by my finger here, and you're gonna, if you can repeat that action for me a couple times, and up, good, and then relax back down, and let's do that again one more time, good. So I can feel the belly. It's not sticking up a lot, but again, this is a pretty small muscle, and a lot of us don't extend our big toe all that often. There are a couple tendons to help us kind of look for the proximate area. So right in this area here, this is extensor hallucis longus tendon. And if he sticks up all of his toes up in the air, this is the extensor digitorum longus tendon. So if you start on that dorsal surface of the calcaneus, you'll lose it as it goes underneath the digitorum, but then you're going to be able to feel a little bit of the belly between the 2 longuses tendon. So hallucis and digitorum. I'm going to place my fingers, I'm going to relax all of his toes down, and then just start to lift that big toe up again for me. Great. So right in here, just the last part of the muscle belly before it turns to tendon, and then that tendon is going to run down the foot and actually go underneath the longest tendon before it inserts into the base of the proximal phalanx. You can go ahead and relax your toe. So again, here is the metatarsal phalangeal joint, and this is the base of that proximal phalanx. So because it's really only crossing this one joint from dorsal surface of calcaneus to proximal phalanx, the only action that it's really doing is extending the big toe at the metatarsal phalangeal joint. And that's going to conclude our palpation of extensor hallucis brevis.